Let's go.
I call to order this Thursday, November 19th, Solon Community School District Board meeting. As board secretary, I will preside over the meeting until annual reorganization takes place. As we begin every meeting, I will share the vision of our district, graduate each and every student prepared for post-secondary success. And our mission statement, engage each and every student in rigorous and relevant experiences, maximizing achievement through exceptional teaching. I will begin with roll call. Brown.
Here.
Coons.
Here.
Alaska.
Here.
Jedlicka.
Here.
Wolf. Here. All present. First order of business is to elect president of the board for the 2020-2021 school year. I will now take nominations at this time.
I'll be right back. I'll nominate Tim Brown.
Okay.
Second.
Okay. Adam Pulaski has nominated Tim Brown, second by Dan Coons. Tim, do you accept the nomination?
Sure.
Thank
Sure
you.
about
Any more nominations for board president? Hearing none, I will look for a motion to close the nominations.
Second.
Jedlicka makes a nomination to close the nominations. Motion, sorry, I said that wrong. And Haleska seconds the motion. All in favor say aye.
Aye.
Opposed, nay. Motion carries 5-2.
401.
4-4-0-1 because Tim won't vote for himself. Looking for a motion to elect Dr. Timothy Brown as school board president. Did I do that wrong? Oh, okay. I will now call the vote.
There.
Jessica.
Yes.
Wolf. Yes. Coons.
Yes. Yes.
Pulaski. Brown. And you still abstain. Motion carries 4-0-1. Tim Brown, congratulations. You are our new board president for this school year.
Thanks.
And now I will give him the oath of office for our new appointed position and allow you to reside over the rest of the meeting. Tim, do you solemnly swear that you will support the Constitution of the United States and of the state of Iowa, that you will faithfully and impartially, to the best of your ability, discharge the duties of the office of board president in the Solon Community School District as now and hereafter required by law?
I will.
Thank you very much. I will slide next.
I need that thing. Oh, no, you'll do the others.
Next on our agenda is to elect the vice president of the board. I will entertain nominations for board vice president.
Make a motion to nominate Adam Lusker, vice president of the board.
Motion by Jedlicka, second by Wolf. Any other nominations? Hearing none, is there a motion to close nominations?
So.
Motion by Coons, second by Jedlicka to close nomination. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries unanimously. Chris, you want to call the roll on the
vote to elect Adam as the vice president of the school? Yes. Jedlicka.
Yes.
Wolf. Yes. Coons.
Yes.
Brown.
yes?
Alaska.
I'll stay.
4-0-1. Congratulations, Adam. You are our new vice president.
Thank you.
Give you your oath. Adam, do you solemnly swear that you will support the Constitution of the United States and the Constitution of the state of Iowa, and that you will faithfully and impartially, to the best of your ability, discharge the duties of the office of board vice president in the Solon Community School District as now and hereafter required by law?
I will.
Thank you very much.
Thank you.
Next item on the agenda is to swear in our board secretary. She doesn't get a choice, so we'll leave it at that. Chris, you solemnly swear that you will support the Constitution of the United States and the Constitution of the state of Iowa, and you will faithfully and impartially, to the best of your ability, discharge the duties of the office of board secretary of the Solon Community School District as now and hereafter required by law.
To the best of my ability, I will.
Thank you, Chris. Well, we are reorganized for another year. Next item on our agenda is we've got the first of our annual meetings that we do with our legislators. I believe Zach is online electronically.
Yep, I see him.
And we appreciate you taking the time out. I think we all want to congratulate you. I think I maybe sent you a note. Congratulations on your election to a leadership position in the Iowa Senate. We're proud of you, and we're proud of the work you do to support the students in our district. So.
Well, thank you very much, Tim. I appreciate it. I'm sorry that I couldn't be with you all tonight in person like we were last year. Obviously, this pandemic has changed a lot of things for all of us. It's obviously a big responsibility to be in the leadership role. It's been a very busy week, frankly, getting up to speed on all the various moving parts. And so I'm glad that we were able to make this work tonight. I've got a couple things on my plate in terms of just things I wanted to follow up on and talk about, and then definitely have a couple questions in terms of you know what's happening up in Solon. I see we've got a bunch of people in the room tonight, and so as I was getting ready for this meeting, I was just going back to my notes from last year. A couple of things that we had talked about were mental health continuing to be a priority, and Lord knows I can only imagine that is even more true this year. Getting SSA in a timely manner rather than in a way that's going to interfere with your budgeting process. And so that's something that I'm going to continue to be focused on. Local control came up a couple times last year. And then also the fact that growth was creating some good problems, but problems nonetheless for Solon. You know, in terms of the SSA and local control, you know, I'm hopeful that we'll continue to get a good SSA number. Obviously, COVID's having a huge impact on state finances. It's not just in Iowa, it's across the country. But I think now more than ever, we're seeing the importance of teachers and public education when it comes to the effect that has on our young people. When it comes to mental health, you know, the children's mental health system had been stood up in the 2019 legislative session. And I believe that there had been the intention of putting more funding into that system this last session, but some of that was derailed to some extent by COVID. That will continue to be a priority for Senate Democrats under my leadership, and is something that we are going to keep pushing going forward. I've got a couple other things that are kind of on my agenda in terms of things I'd love to get your input on, but obviously the most important question that I have for all of you is, what are your priorities for the 2021 session?
I don't know if Adam just participated in the as our delegate to the Iowa Association of School Boards Delegate Assembly. And so we went through this process, and I think you touched on a couple of them. Mental health is obviously remains one of our strongest priorities. You know, I think as you and I chatted about last year and probably the year before that, you know, the state has kind of dropped the ball over the last decade as mental health has become a bigger issue. It's getting pushed more down to our teachers and our nurses to deal with these problems that there used to be broader supports for. And you know, I think the more we can do to provide support for those students from a mental health standpoint more broadly than just during the school day is important. Obviously, SSA remains one of our key priorities, and we realize that, you know, budgets are tight everywhere. We ask that you do what you can, but the most important thing from us from a planning standpoint is to get that number as quickly as we can during the year. It just, you know, we've had years where it drags out to May or June, and it's like, you know, we've certified a budget for months, and we're going on a hope and a prayer that we're going to get something that we can make our budget work with. So, Adam, were there specific topics you wanted to bring up from last night and from what we had said in previously?
Yeah, I think mental health is one of the number one things, and especially with all what teachers are dealing with right now. You know, trying not to throw too many more things on the plate. So that's one thing from the school board. You know, we talked about even substitutes, right? That's been a hard thing to find. And then, you know, even some of the guidelines of, you know, they talked about mental health stuff that some of these substitutes would have to qualify for, or some of the educational stuff behind it. Just, you know, not making it more difficult for people to get in here and you know, be a sub, or even for our teachers, once again, just taking more stuff off their plate, because with this stuff right now, they're just extremely busy, and I can't even imagine, you know, how overwhelming it can be during the course of a day. So
I think that's a good point. I'll touch briefly on that. And I don't remember if we talked about this, Zach, but, you know, one of the examples I remember from Mount Pleasant, they had a couple years ago talked about the fact that they had explored having former governor and a secretary of the U.S. government come in and be a teacher for their history and their government classes. But he wasn't qualified to be licensed as a high school government teacher, even though he was teaching at a college and had all this experience. And so I think, I think this creates its own challenges as we've gone through COVID. But I think as you guys look back at those things, maybe talk to places like that about, you've got these unique people. How do we create a venue where we don't say anybody can teach, but we take some of these unique people that bring skills where they apply and figure out how do we make this so they could be a substitute or, fill those roles. But I know Mount Pleasant brought that up a couple years in a row. It's like Governor Vilsack can't teach government in our high school. And so,
Yeah.
But it's a challenge. How do you balance that? Because you don't want to open the floodgates and say anybody can come and teach. But at the same time, some of them are a little more obvious than others.
Well, I think like a lot of things in state government, obviously there's always trade-offs. I will say that the licensing piece is something that we've, I think, actually been looking at for a year or two now. It's something that we hear about a lot, and then obviously with COVID and the impacts that COVID is having on the workforce, that's something that's only grown more true. And is that something that you said that you were having challenge finding substitute teachers, or was it teachers to fill FTE roles?
So I think what Adam referred to as a substitute issue, what we've heard is across the state, everyone's having problems finding subs.
Of course.
Somebody asked me about it, and the answer I gave is, we had trouble finding subs 2 years ago, we had trouble finding subs last year, we have trouble finding subs this year, we'll have trouble finding subs next year. It's a constant battle because, the reimbursement rates are relatively low, and, and there's other things that they can do, and so the challenge becomes at one level there's a finance issue to it, and a lot of times we're relying, and I'm looking at Mary Angelica, a lot of times we're relying on our teachers to retire to want to come back in and substitute after they've been out 6 months or a year. And so I think we're happy to have them come back in, but it could be more, we could be more creative in how we make that work. And so subs are obviously an issue. We've been making it work so far, but we can always use more. So
that's absolutely something that is it's good to have some a concrete story to go back and share with folks in Des Moines. I think that's, I know that obviously we've got some dedicated funds that are out there for things like TLC or what have you, and it would be interesting to see in some of this transportation plus up money. So maybe that's an area where there could be some options for some dedicated sources of funding. Although, as to your point, that's obviously a general part of SSA overall. Let's see, I'm just kind of going through my list. I'm not looking away. I'm just looking at the list of things that I had here on my screen.
Yeah, I have that same issue at home. I've got my camera here, and I've got my monitors laid out.
Yeah, no, you've got it. You've got it. I know one of the things that I'd be interested in, I know that some of these return to learn plans required districts and leaders to determine how to meet that increased demand for the social and emotional supports for students. And to the extent, to Adam's question about the impact that we're seeing on students from the emotional, mental health side of things, could you just maybe, what's working in Solon? What are you doing? What's working? What's not working?
I'll let Davis speak a little bit. He's got more direct contact with that. So I'm going to let Davis give you a better answer than I can give you as a board member, because he's in the trenches every day.
Yeah, well, if Josh, if you're on and listening, you're welcome to speak up also. Part of the return to learn plan was one component was the mental health component. Josh, you want to take over since you led that part?
Well, I think from a standpoint of the return to learn plan, we really took a lot of efforts, our counselors took a lot of efforts to really take a look at what do our students need in regards to coming back to school, what supports do families need. I think that's a big piece is what do families need, especially now in this time where there's a pandemic, there's a lot of question marks in terms of kids being at home, kids being at school, and trying to support families that way. talking with a few families that we do have online using our online system that we purchased. We've talked with just a few families where their kids are struggling at home, and trying to connect them with our counselor, our counselors at school.
Josh, about what percentage of Solon families chose the kind of all online at-home option?
In terms of percentage, I can give you a number specifically.
A number's fine.
Yeah, currently right now, out of 1,500 kids, we have 60 students online.
Okay, 4%.
Yeah. So I'd say in terms of
trying to make sure that those students are connected with counselors and
right. And then, from a system standpoint, we've really tried to take a stance of really, one, screening our students. Where are they? And their social emotional health. And it's not a diagnostic. It really is, what skills are they missing? What are they struggling with in terms of perseverance, in terms of challenges with social issues or friendships, those types of things. Those are just a couple of examples. I think we've always talked along the way of, what additional support can we get in terms of hiring additional counselors, and counselors are hard to find, and that support. But obviously through our district as well, we're gathering support from the JFAST program that we've invested in and piloted. So we're trying to find those outside resources too. I think that's another big thing, is what are the outside resources that are available in our area, especially I'd say for those rural areas. Obviously, I think we're lucky because we sit between Cedar Rapids and Iowa City, but we're still we're kind of out there, and we have some resources, but it's that partnership and community partnership that we need.
Yeah, Zach, so we have a district, we put together 3 years ago a district-wide mental health advisory committee that included school personnel and professionals within our community, members representing each of the churches, different social areas. It was about a 45-person team. We did a kind of an analysis of our school district and what we currently are doing, what we're offering, things like that. And what we found was, our counselors do a very good job with the core, with providing lessons for all students. Our counselors, we have good things in place through some training for a small group. But when it came to more of those intense needs and connecting families with external resources, we weren't doing a very good job. And so we did partner up through the area education agency, and I think they received money from state legislature, but we partnered with the AA, and we were part of a 7-district consortium through the AA that provided us JFAST services, and it has been extremely helpful.
That's good to hear.
I think another component for just our teachers and equipping our teachers and helping them, there's also, it's supporting our students, but also that self-care from an adult standpoint of our teachers, but it goes through that professional development. What funds are available to continue to help support us with mental health to provide that professional development? This last fall, we brought in Please Pass the Love, that organization, I think out of the Des Moines area. And actually they were cited in the Return to Learn documentation from the Department of Education as a source, and we utilize that source.
Okay.
So it's that piece too, the professional development that we need.
Yeah. Okay. Josh, were you in charge of the Return to Learn plans?
Well,
I presume it was a huge undertaking. Yeah. Could you when we all obviously we've been tracking this very closely, trying to see school districts are required to put these plans together. Can you maybe walk me through what was that process like? I mean, obviously the kind of COVID really reared its head in March. We suspended school, switched to all online. School districts were tasked with putting back together Return to Learn plans. Can you just maybe walk me through a little bit? What was your experience like with that process, and did you feel like you were getting good support from the Department of Education, AEAs? Talk to me a little bit about that process.
I think that whole process, I really appreciated the Department of Education support in regards to, they really kind of laid out a framework of 7 big areas that we should focus on. And taking those big areas for us, we then created a district-wide team of different cohorts of teachers and administrators and counselors and nurses to help kind of mold some of the, really just the basic big ideas for the district over the course of the end of May and into June, and then trying to finalize some things in July from a district standpoint, and then really allowing our principals and their leadership teams to run with that information and really adapt and adopt some of those big pieces, those big ideas that we talked as a district to their specific buildings. Of course, trying to ensure some consistency, but at the same time, understanding the unique context of a high school versus an elementary school versus a preschool classroom, and really allowing that collaboration to develop into really not just the district return to learn plan, but each building's return to learn plan as an offshoot. So,
Okay.
But it was, I would say it was pretty intense over the course of the summer. So
Totally. I know there's obviously a huge amount of conversation around the process of switching between in-person, hybrid, all online, and as we kind of like ramp, as the virus is obviously ramping back up into the second wave, full winter wave here. What are the metrics that Solon is using to make that determination? What's like what are the positivity rate, number of positives? Just talk to me about that whole process.
Davis, you want to talk a little bit about that from your perspective?
We really look at a variety of data, not just one data point, but we look at absenteeism, which includes all illnesses. We look at positive cases within our system. You know, we have to look at staff availability. Again, our principals are doing a great job of meeting with their leadership team. So staff feedback's a big issue as far as they're part of looking at that data also. And then recently we've been looking at the total percent of students not in attendance for any reason.
James, do you want
How is that different from absenteeism?
Absenteeism doesn't include quarantines.
Oh, okay.
So yeah.
Zach, one piece of data that we'd like to have that we don't have is zip code level data. And so we know that some of our schools around the state have been getting zip code level data, but it's a county by county thing. And so Johnson County doesn't feed out zip code level data. So we can't look at 52333 and see what's going on in our community. But if you're in Warren County, you can get zip code level data. And so somewhere there's something in that process that some states have access to it and others, or some counties have access to it and some don't. And I don't know where that happens. I don't know if it's a processing thing from the state. I'm assuming there's a zip code attached to everything at the state level, but I'm not sure why. And so that was one of the data points that Davis and I were talking about. And Davis talked to our nurses and they said they've been asking about it for a while now. It would just give us a better idea of what's going on, rather than Johnson County as a whole. It would allow us to zoom in and say, okay, within the confines of our school district, how do we differ from Johnson County as a whole? Are we doing better or are we doing worse? Because there's a lot of things going on in Johnson County between the school, the hospital, between the university, the hospital, and the prison in Johnson County. There's a lot of different things that factor in there, and it would help us better understand the data if we knew what was going on in our community.
Absolutely. And Tim, did you say that you had been in touch with Johnson County about whether or not they were doing that, or that
we had talked to Johnson County, they do not have that data for us. So,
and Johnson County told you that they weren't getting it from the state, is that right?
It's not clear where the breakdown's at. They just said it's available. So I don't know if it's one of those things where they don't know that it's out there and they could request it, or if it's that it's only in parts of the state that they have that level of detail. We just don't know. But you asked about data. That's a data point we'd love to have.
Okay. Tim, I will have my staff call the Johnson County Public Health Director tomorrow, and if it is a state issue, we will get it fixed as quickly as we can. If it's a county issue, I'll make sure that they know that's something that you guys really would like to have.
Sounds good. We appreciate that.
Absolutely. I'm trying to think about any other kind of, the metrics that are that you're using going into online, hybrid, in person. how prescriptive are those from the state? How much of that was driven by Solon? How much of that is top down? How much of that is ground up?
The metrics or the determination,
Yes, the metrics.
it's ground up. When we put together, we had a team like Josh was describing. We had a team of 38 district staff, from administrators, teachers, directors like our transportation, nutrition, facilities, nurses, counselors. They were all part of developing this return to learn plan. And as we were putting each component of those plans together, we were pretty much in agreement that the best place for kids to be is at school, socially, emotionally, academically.
Sure.
So in June, when we started putting this together, we were driving our plan to put kids in seats and safely in classrooms. And so that's what we built our plan on. Now, we also knowing reality that there may be a time when we have to fluidly transition to virtual at home, back to on-site, back to virtual.
Right.
I mean, you can't predict the data. And so we also,
well, Iowa City just went virtual this week. Am I
yeah,
right? Yeah.
I mean, a big part of our plan was to train and equip our teachers on a couple different platforms, online platforms, so that as soon as we got our kids back in school, we could quickly teach them those platforms, knowing that at some point it's very possible that we could be going home online virtual. And so we're prepared for it. That's in our plan. Our teachers have prepped. We added 3 additional work days for teachers. They typically have 3 before kids return. We had 6, so we could devote more time to training of those online platforms so that we could be prepared. But we haven't needed to go there yet.
Fantastic. And are the return to learn plans are public?
Yes. Yeah, everything's on our website. You go to our website, you can click on a return to learn tab that has all of our documents, plus it has a dashboard that's updated daily on some of those metrics.
Got it.
So you know,
2020, what a year, huh?
Yep.
So I think one of the things I heard, and obviously it's not restricted to just this district, but one of the things I heard at the Iowa Association of School Boards, it's on the sessions, is a lot of the things that are driving districts online are staffing issues. They ran out of bus drivers, they ran out of food service, they ran out of, they didn't have enough subs to keep things open. And so I think I commend everyone in our district. We try to find creative ways to avoid those staffing issues. But obviously the worry is there that we're going to, as David said, we'd like to keep kids in school safely as long as we can. When time comes, we've got a plan for transitioning online. We hope it doesn't come, but we'd be naive to believe that there won't be a time when it becomes necessary. So.
Yeah. No, it's been obviously an incredibly distressing last couple of weeks as we've seen things really start to escalate in a pretty dramatic way. And I, this is when I decided to run for the Iowa Senate in 2018, I never would have guessed that I'd be dealing with a global pandemic in my very first term. I know it's been a really difficult and scary process. I know people have lost family, friends, and this is a really awful thing that everybody's dealing with. And so, my heart goes out to the students who are being affected by this, the teachers, the parents, folks who are obviously in the classroom. So, I wish I could tell you what was going to happen over these next few weeks here. I've been really excited to get some of the news about some of the vaccines that are starting to come online. And actually, I don't know how many folks know this, but, a lot of the Pfizer trial, for example, was actually at UIHC. So there were folks here in our neck of the woods who were participating in that. So at the state level, I'll tell you that my caucus and I know this is a bipartisan issue, obviously, completely, making sure that the moment that vaccine is ready to go, that we have state government ready to distribute it. We'll be working in close coordination with the Department of Defense at a federal level for those vaccines to be shipped into the state. And then obviously at the state level, we'll be distributing that mostly through the county public health offices. So that's going to be a big thing that's coming down the pike. I'm not sure I've got a whole lot else. I'm actually already late for a 6 o'clock call here. But the one last thing I would say is, I've gotten messages from some Solon parents who I know are concerned about how things are going. And so I would say to the parents who are worried, please keep speaking up and engaging with people. I see you can obviously see a lot of them here tonight. And please continue to stay involved, stay engaged. If you ever have questions about what the state is doing, do not ever hesitate to email me. Davis, I'm going to put my email address here in the chat box. I know this is easy to find, but just so people have it, never hesitate to send me an email and let me know what you're seeing, what you're hearing. I always appreciate hearing from people directly. So President Brown, thanks again for inviting me to be with you all tonight.
Thanks. And I will send a shout out. Zach is always very responsive. Whenever I send an email, I generally hear back from him within about 24 hours. So I do appreciate that. I know you got a lot going on. I will point out, as with everybody, when you're in session, it's better to not expect a response in 24 hours from anybody at the legislature. But
I would also say that this week is a little unusual. I'd say the last 10 days, just with everything going on with the leadership election. And so I know that there are a couple folks who have emailed me probably in the last week and even today who I haven't had the chance to get back to yet. But I'll be doing so as quickly as I can. And I hope that the conversation that we had tonight reflected the input that I've heard from the constituents who have reached out. And obviously that we're carrying through some of these recurring elements that are now happening from kind of year to year to year. Things like the mental health funding and getting us to say in a timely manner. So again, I appreciate the invitation. Let's continue to keep the door open. Even though as the leader, I'm not sure that I will be serving on the education committee. I'm still going to be very, very connected to education issues. Public education was a big part of why I decided to get into state politics. It continues to be a big priority for me as well. So thank you all very much. I appreciate it.
Zach, I will let you know. We'll send you a link. There'll be a video that's posted tomorrow as part of our normal process. I know we've got some parents and some students that are ready for public comment. We'll kick off right after this. And so if you want to take a gander back at that tomorrow, you'll have a link to it so you can listen in and hear what public comment was tonight. So.
Sounds good. Thank you all very much. Have a good rest of your night. See ya.
Okay, so I will apologize to everyone. A couple things to cover up. Normally, the first thing we do is public comment, but I remember Zach had a conflict right at 6, we went right to that after we did our board meeting. For those of you that are listening in later or are here now, generally, the way this process works is for public comment, people register with the board secretary in advance. We put you on a list, and Chris has gone over this with everybody. There's a period of time set by policy of 20 minutes for public comment at the beginning of the meeting. And we have the complications this week because of the change from the governor on Tuesday that we are in a spot where there are limitations on how many people can be here. I apologize for that, but with the short turnaround, we've kind of gone as we have planned, and we do have a number of people registered, and we do have, and although we don't generally do this because of, we will read one public comment in that we got by email from somebody yesterday who wasn't going to be able to make it. So we've got the public comment. We'll read that in, which is not something we normally would do during public comment. Normally we just send that to the board members and let them, but they asked if we could read it into the record. And I told Chris that we could do that. If somebody else had been elected board president, they might have overrode me, but since I was, my decision stands. So Chris is going to start, and then we got a list, and so they're going to be a little bit jumping as we cycle people around. We do appreciate everyone coming tonight and sharing their input. So, and last thing before we do this, just so you don't think we're being rude, because the way public comment works is you guys talk to us and we listen. You'll see us take notes. But it's not a two-way interaction, and so we will listen and take that input as we consider things moving forward. But it's not a conversation, so don't take it as that we're not interested if we don't ask follow-up questions or respond. So
yeah,
and I guess at the beginning, Chris probably told you this, but say your name at the beginning of the
yeah.
Of your,
Yep. And we have got 11 people that have registered to speak. Kind of caught me off guard. We didn't have anybody, and then I got an influx kind of some people this afternoon. So though appreciative, I did my best to try to get it organized as quickly as I could. You each are going to get about a minute and a half, and I kind of explained that to you. We've got 3 boys that want to come in together. 3 of you will need to step out. So those 3 boys will get 4.5 minutes. I'm going to raise my hand when you have about 30 seconds left. Please be courteous because I want everybody to be able to speak. I'm so impressed that we've got even some high school students here that are interested in sharing their feelings, but we'll kind of get through this with, remember, we've got some teenagers involved as well. So just everyone be respectful, and again, the board will just be able to listen, but they do appreciate everything you have to say. The first, I will start out, this is from Ann Johnson. She had sent us an email yesterday, and because of the pandemic was not feeling comfortable in coming. So I am going to start the time. What I'll do is I'll start the timer. I'm going to read this, and this is how I do with everyone else. I'll shut the timer off. The 20 minutes isn't involved in switching from one person to the next. So here we go. Again, this is from Ann Johnson for the record. I am not at the board meeting tonight because it is not recommended that we gather with those outside of our household, and a live virtual option was not provided to the community. On Wednesday, November 18th, 5 of our 488 high school students were diagnosed with COVID-19 in a single day. The number of new cases in our district has been growing exponentially since Halloween. While I understand that I will allow schools to remain open, given potential conflict of interest issues, which third-party medical experts by name and title recommended that the high school remain open for face-to-face instruction after Thanksgiving. Do our school nurses support this recommendation? Signed, Ann Johnson. Okay, so that was, I'm going to kind of give each time too. So that took me 46 seconds. Next speaker is Amber Marty. If you could just step up on the X, we appreciate that.
I might sit if that's okay.
Yep, that's
I
fine.
can go through
Yep, absolutely.
holding without the podium, if that's okay.
Yep, and again, when it gets to a minute, I'll raise my hand. When it gets to a minute 15, I'll raise my hand again, and then you gotta kind of just wind it down. Okay?
All right.
All right.
So
Go ahead.
Amber Marty, good evening. Thank you for allowing me to speak tonight. I am here to talk about the success of our district programming and all staff. I want to personally thank our administration for respectfully allowing choice among our stakeholders to attend school in person or online. I have been a substitute teacher in our district for close to 10 years. I have also a social work degree. My son Gage is a junior at the high school. My daughter Gabrielle is a sophomore and student athlete at Baylor University. I have substitute taught weekly through this pandemic, and I want to tell you a little bit about that experience. Day one, I encountered arriving at school 30 minutes early to sanitize and monitor spacing of students. Janitors are busy cleaning, wiping down door handles and railings. Building principals are pacing halls and ensuring student safety. I was then greeted immediately with a lead teacher who explained all safety measures, student pods and spacing, sanitation practices, and student expectations thoroughly. I was told exactly the measures of cleaning that would take place throughout the day. Students came in and reminded me again of these measures, and I checked to see if I had, for example, sprayed the tables properly. I quickly learned that I would put my reservations and sanitation practice and student safety at bay because the students absolutely were there to remind me and make double sure protocols were met. Students are safe. I want to stress today that I have learned subbing in our district. Our staff is working their tails off to keep our students safe, and they are being successful. Our staff is providing successful education and providing successful instruction in their absence when quarantined. Students want to be in school. They are not fearful. They remind me of this every day. Students were in tears at the cancellation of athletics this week. I am asking today for the continued choice among our district to attend in-class learning full-time. I am asking our boarding and administration to please consider the need for routine normalcy among academic and athletic programming. As a parent of a high school student, please understand the difference in trying to teach pre-calc and chemistry at the high school level at home versus basic reading and writing. Please understand the difference among our students who are successful online and those who cannot. Lastly, I ask that recognize the social media groups for what they are. They are noise. They are 20% actually contributing to these groups. Please hold steady, recognize the noise, remind yourself of the numbers that have chosen in-class learning today in our recent surveys. Please keep student in-class learning and programming full-time as an option for all students.
Thank you. Okay, that was 2 minutes and 38 seconds, which is fine. You have 5 minutes, but someone else will just have to cut their time down. Eric Carson is next. So Amber, do you want to step out when Eric comes in? Thank you so much. Eric, you want to come in? Okay. Yeah, there's 2. Okay, perfect. So Eric and I'll let you say your names. So together, you guys have 3 minutes. Okay, I'll raise my hand when you have 2 minutes and then wind it down.
My name is Lucas Teeple. I'm a senior at Solon High School, and I would think that it'd be easiest to stay in school because a lot of kids adjust to hands-on learning way better than being on a computer at home. They get distracted, and sometimes with a busy schedule, even at home, you make time for school, but sometimes the times just don't work out and you're still stressed out.
Yeah, just kind of to just bounce off Lucas's idea. I mean, taking calculus and chemistry all at home, that is so stressful. And just being able to get like hands-on learning from the teacher that can actually like physically walk you through the steps through any problem that you have just makes learning so much easier compared to being online where you have to send an email, you have to wait for them to get back, and then there's just a big old thing of confusion. I'd also like to say, I mean, we are seniors, and the last thing that we'd want to do is to have our athletic careers be over from this COVID-19. And I know that just from football, I mean, we've taken so many precautions just to even have a football season, and I don't really want to see my friends and stuff not be able to try and make history and have a very successful football and basketball season.
Thank you, guys.
Thanks, guys.
That was 1 minute and 23 seconds, so put us back on track. Gage Marty's next. And Amber, if you want to come back when you can. Oh, there is, okay. Okay. Nash and Gage.
We're going to come in together.
That's right, that's perfect. Yep, you're welcome to do that. Hold on just a second, let me reset. Just make sure to say your names and then you can get started. Go ahead.
Hi, I'm Gage Marty and I'm a junior. I would just like to say that we're in school and we feel safe in school. And if we got out of school, that it would be really hard to learn as well as we do in school. And when we're in school, we feel safe and we're doing all the things we need to do to stay safe in school. And everybody's taking that very seriously. And just like to say that we would all like to play sports, and that's the last thing that the seniors want, and all of us want is not to be able to play sports. So.
My name is Nash Altman, I'm a senior. I'd like to say that I think virtual learning is a lot more challenging for students, both emotionally and literally the classwork. Not only is it harder to get all the work done online when I prefer pen and pencil myself, but also emotionally, you don't get to see your friends, you don't get to see your teachers, and it's just, there's a lot of distance there between the two. I feel like morale was very low when we were in the virtual learning. And I feel like since we've picked up school again in person and we've had sports, and I think that morale in the school is much higher now, and a lot of students are a lot more happy. I think the football season went very well because of the efforts we made to stay safe and keep everyone else safe. Whether that be with masks or social distancing, just keep doing that stuff, and I think it's working so far. Thank you.
I'd like to add one more thing. Even if we got out of school, people would still gather, and I think schools is helping with that. So yeah.
Thank you, guys.
Thank you.
Well, that was 1 minute, 55.5 seconds. Okay, so Denisha, And if Amber would like to come
Can I
back.
have Open go before me, because he has to leave for practice?
Yeah, absolutely. So Open will go first. Okay.
Open, you go first.
Mom's in charge.
Yeah.
Open, you're brave to come by yourself.
Yeah.
Right, go ahead.
I'm Logan Foster. I'm a sophomore. I'd just like to thank you guys for letting me come and speak to you. And I thank you guys for letting us play summer and fall sports and allowing us to start winter sports. I'd just like to say that my friends and I, my teammates and I, are willing to do whatever it takes following the rules to continue playing winter sports. It's very important to us. I am personally enrolled, I'm a dual enrolled student. I'm enrolled in Kirkwood and Solon in-person classes. I can tell the significant difference between the Solon classes and the Kirkwood classes. My Kirkwood classes, I feel it's really hard to retain information after listening to classes, and I find it very hard to pay attention and stay focused in the classes. I also have other friends from districts across the state that have gone fully online now, and I've heard like only negative things from them, that it's very boring and it's way harder than in-person classes. My final talking point is the reason I go to school. I know you guys don't like to hear this, but it's for my friends and sports. I don't wake up in the morning to go to math and just learn science. I wake up in the morning to go talk to my friends, socialize, and go to practice after school. And honestly, when was the last time you guys heard the majority of the student body saying, please don't take us out of school? Thank you.
Okay, can I ask one question?
Yes.
Is Kirkwood all virtual?
Yes, okay, it is all virtual.
Thank you.
Thank you.
Thank you.
I am Denisha Pugh, and that was my son Oaken, and I also have a freshman at Iowa State who went through Solon, who's all online and struggling extremely right now with online schooling. So I have some good notes here that I was going to say a lot of things. The first and foremost is that I want to say thank you to you guys. I know what you're facing. I'm on the phone every day for my job with hospital administrators. I know what they're facing there. But I know as administrators of schools what you're facing, and I know it's equally challenging. You guys have done everything you can to keep our kids safe and keep them in school, and you're doing it. We're doing it successfully. The CDC just came out with some very interesting statistics that they published on November 13th of this year, so just 6 days ago, from comparing March to October of this year versus March to October of last year of ER visits related to mental health among our children school age. They broke it down to children being 5 to 11 years old. There was an increase of 24% of ER visits for mental health. And for ages 12 to 17, which we're calling adolescents, is a 31% increase in mental health in the ER. And those are only people who have sought help. And these kids are struggling. They're struggling because they've been put online. Because of all of this, we need to keep these kids in school. We know that that's where they're best mentally and physically. I think that I would be remiss to not say the Solon demographic, but a majority we mostly have resources. The biggest population of our school isn't starving and needing food and clothing. We are very blessed for that. I don't want to go without saying that we're equipped and we're blessed, but we're also exhausted. We were not equipped. I don't care how blessed and how great our families are. We were not ready for pandemics and having our kids working at home and teaching and learning at home. We're working from home too, partly. We're trying to help everything that we can and all the mitigation efforts within our homes and our work. We are not prepared to have our kids at home and then also deal with that on top of it. So I know just with my children, it's difficult. I can't imagine as a district what you're doing. So just know that we can't handle it at home to keep these kids at home. So
2.5 minutes.
we know that they need to be in school. The last thing I want to say that I wasn't going to say, but I heard the very first email is from a parent who has a student in school and has a student in sports. So I don't understand how these parents, they have a choice. Zach reiterated it today. If you don't want your kids in school, keep them at home. I love that you guys gave us choices in our district. If you take away school and take away sports, you took away our choice. Right now, everyone has a choice. And I so appreciate that. And I just want to reiterate that you guys, we give you the credit for giving us the choices. If you take away sports in school, all you did was take away the choice for the majority of the students and the parents. So Thank you, keep up the good fight, and we appreciate you.
Thank you. Monica.
I'm gonna sit too because those who know me know I'm pretty chill. So, my name's Monica Chapman, and I have 4 high school students. 3 are seniors and 1 is a junior. So, I kind of have a unique situation. So I'm a little bit in a rough spot this year. So when I had triplet babies and I went in public, everybody's like, oh, wait till their senior year in high school. Wait till they graduate. So I've been listening to this for 17 years. So guess what? Pandemic hits 2020, now look where you're at. So I'm gonna hit kind of a little family aspect of this and give you kind of my personal story of what happened in our house and how an impact of not keeping these kids in school is on a situation where you have more than 1 high school kid or you have more than 10 kids. They don't get a second senior year. They don't get to make this up in 7th grade, 9th grade, 10th grade. They're done, this is it. The job of the school right now is to keep these kids moving forward so that they can progress into society, so that they can go on to college. That's our goal, right? We want what? You guys have a percentage that you try to get moved on to college. We can't do that if our kids aren't here. If we can't work with our senior kids, if we can't do that, we can't successfully say that we did our best to do that. March came around, spring break came around, everybody's ready to go do up their thing, pandemic hits, and we're going online. What happens at the Chapman house? Well, we're a small business, self-employed. My husband has a laptop. I work for a small company. I have a work laptop. That's what we have at our house. We didn't need devices. We don't have devices. We're a small business. That's what we operate on. School loaned us 2 computers, but we still have 4 high school kids, 2 of them learning from Kirkwood. How do you function? Can I afford to go out and buy 2 laptops? So then we ended up with 2 computers from the school. Great help. We managed it. Some of you live in my neighborhood. How is our Wi-Fi? We do not have fiber optic Wi-Fi in town in Solon. And even if we did, I don't know really what that looks like because we don't, but the broadband width would not adjust to have 6 of us. We get kicked off every Zoom that any kid in our house tried to get on. It just didn't work. Kirkwood and Solon. Another quick personal story since I'm away. I can never talk more than 1 minute. We have 1 student in our house who got a job working at the nursing home, and everybody knows what the Solon nursing home ended up looking like. And she was caught in the middle of all of that. Working at the nursing home, you are allowed to test, and routinely they would check them once a week, maybe once 2 weeks. You could kind of pick and choose, but she made sure that she tested every 14 weeks. She's been tested and testing this entire time since she started, which was before the outbreak even in the nursing home. She is every single class that she has attended in Solon High School so far has had COVID positive students in her classroom. She has yet to get COVID. Not every kid is affected by this. Not every kid is going to get this. Not every kid functions well at home. Every situation is unique. Every kid is unique. We have to think past that. I'm asking you guys today, stick to your plan. You guys had 38 team crew that works day and night, and you worked your tails off for this plan. You have a plan. It's emailed out to us once a week, once a month. Here's the new details. Let's stick to the plan like we made it, and keep going. You guys did a great job. I put all my trust in you. I trust every single one of you. Rick, I don't know you very well, but I do trust you. I know that that's very trustful. I've been here for a long time. Please.
I'll take it. Even with the face mask?
I know our kids' souls are at your hands, and I appreciate you all. Thank you.
Thank you, Monica. Becky Shy. So we have 3 people left each. Like, if you could try to really stick to 2 minutes, that'd be great.
Sorry.
No,
gosh, I don't care.
Okay,
my name's Becky Shy. I have 2 high schoolers at Solon. I think it's important to stress that we all need to make decisions that are best for our children. And I think you guys have the perfect model in place. We all can make that decision. If we don't feel safe, you can keep your kid home. If you do feel safe, which by the way I do, you can send your kids. I think I would encourage you and implore you to please continue with that model. From an academic perspective, I think with math in particular, it is really, really difficult for a kid who's trying to follow along in calculus and misses one small point to wait 3-4 days for a Zoom meeting where he or she can ask a question. And then by that time, they've given up, you know, it's just hard, or wait for an email from a teacher. And no disrespect to the teachers, because I know they've got lots of emails to answer, but those answers don't always come quick enough where they've lost their focus. Which is another thing. I think with the online learning, I think kids lose their focus a lot. They're sidetracked, they're busy with that, they're busy with this. It's really difficult. So I would encourage you to please continue with the choice to continue with in-person learning. From a social mental standpoint, I think the kids need to be together. If we think that going to strictly virtual learning means they're gonna stay in their house or go out with masks on, I think we're crazy. Nobody wants to wear masks. I hate wearing masks, but I do. These kids are gonna gather. They're gonna gather together, and they're likely gonna take their mask off. So a controlled environment like the school, where unfortunately you have to police it, but it's working. I mean, our kids are wearing masks all day long. They're using hand sanitizer. They're spacing. It's working. Did you raise your hand? Okay, good. Okay. Yeah.
She doesn't want you to call her on her.
Thank you. I think the board, the administration, you guys are doing a great job. I feel safe. My kids feel safe. Please continue and let us learn in school. Lots of these kids, I know sports seems like a minor thing to a lot, but my kids in particular, you have no idea the hours they have put in to being good at something. And if you take that from them, you know, from an academic point, they don't have that be their driver, but some kids only keep their grades up to play a sport. If you take that, that's a real detriment to some of those kids. So thank you, and keep that.
Thank you. Tina Hoffman? Yeah. Hi, Tina.
This is the first time I've ever come to talk at the board meeting, and I always have to remind myself I don't like to do these kind of things. It's kind of hard for me to separate my AEA hat as administrator there and my mom hat. And as I came in tonight, the one thing I thought of, I opened up some emails, and we are getting constant numbers and updates at our AEA as well. And we serve 32 different county school districts across 7 different counties. And the thing that caught my eye tonight right before I came in was, of the 7 counties that we serve, Johnson County right now has the lowest number of positive rates. Now it depends on, of course, how you're calculating. I totally get that. But that just kind of struck me. And the thing that I wanted to think about with this group is, it means that it's okay for us to make our decision for Solon, what's best for our kids, our community, and right here. We don't have to follow the other school districts and the bigger districts and what they're doing. I think it's important for us to think about what's right for our community and our people right here and our kids. And I think it's amazing that our kids came in tonight and gave it from their heart of what's important to them and what they need so that they can grow up to be independent people out there. So for my mom hat, I got a senior, and well, you know, he's so cool. And then I got a sophomore who's just adorable. And they have very different needs. My youngest has actually asthma, so it was a big decision for me to try to send him to school. So I am very, very thankful. I have lots of thanks to the school district. The communication this year has been so clear, very frequent, which I truly appreciate, and it makes me have trust that I'm getting that updated information so that if I want to pull my child, because that's a choice to go to virtual, I got the information that I can make that choice. That's what's important, is that each family has their own choice to do what's right for them. And for Braden, maybe I do sometime need to pull him and make him virtual because he might have a different health need. Colton, he needs to be in with his friends and out and learning because he's going to go to college next year. He needs those opportunities to problem solve and be independent and be communicating and out there with his friends and his peers because he needs to do it on his own next year. So as a parent, I just want to say thank you. The school, I think, has been doing a great job of communication this year. That has just been extremely evident. Thank you, school administrators, please, for that. That's huge, is because people will make up their own story in the absence of information, right? And so that frequency of information is just excellent. So thank you, guys. I know that kids are going to benefit from being in schools.
Thank you.
So Braden, thank you for the email.
I will.
Last speaker that has registered is Stephanie Edmonds.
Hi, I think a lot of you know me by now, but in case you don't, I'm Stephanie Evans. I'm a nurse scientist at the University of Iowa Hospitals and Clinics. I have a PhD in nursing and a master's degree in public health. I have like a lot of planned stuff, but some of the comments from other parents and students, I kind of want to change it up a little bit. I don't want to talk about whether we should go virtual or we should cancel schools or cancel sports or other activities. I'm not going to talk about those things. What I'm going to talk about is just safety. So I believe that as parents and teachers and school administrators, we all are wanting the same thing. We want what's best for our kids. That's what I'm hearing from other parents. That's what the students are saying. We're worried about mental health, and that's what I want too. But what I see right now is really concerning me. The hospitals are over capacity. I'm working with nurses and physicians who are desperate. They're desperate for us to do our part, and we are not. I see people in Solon all the time, no masks, they're gathering together. I really worry about what's going to happen at Thanksgiving. So if we want to stay in school, I think that's so important, but we need to do our part. We're begging you. I think that we need to show our high schoolers that they need to wear masks and they need to stop hanging out together, if that's what we want to do. The other part of this is that I'm really discouraged by what I'm hearing from some of the teachers. It seems to not be the same as what I'm hearing from the administrators, that people are not having enough cleaning supplies, and then they don't feel comfortable going to administrators with their concerns. And that's what I'm mostly concerned. That there seems to be this level of fear and intimidation coming from the top. And I think that is something that needs to be looked into. I've heard that before COVID, and I'm hearing that even more now. So I think we need to do better. I also have some data. Some of you know Kelly Baker. She's a professor at the University of Iowa College of Public Health. She had a student in Solon and she's pulled them out for this year because of COVID. She ran some data and compared us to other schools, and I just will summarize it. Compared to Iowa City, Cedar Rapids, Lynn Mar, and Mount Vernon.
Stephanie, I'm just gonna stop you. I'm gonna stop it right now for a second. You're at 3 minutes. I'll give you like another minute.
Okay, that's fine. I'm almost done.
And I'm letting you talk more than anyone else, but I'll give you 1 more minute. Okay, go ahead.
Solon students there's a strong evidence that Solon students are significantly more likely than any other school district to get COVID, and some are the same with staff. I'm happy to leave these with you.
I'll put one for the record too. Thanks. Thanks.
Thank you.
Thank you. That's it. That's all our speakers.
Okay.
So we have the nurses that are part of the meeting. I don't know if Monica and Dennis, are you guys planning on staying? Sure you plan on meeting?
Sure, I'm planning on staying.
Okay.
At this point, I'm in for the long haul.
Okay.
So we'll exit. You need us to go.
Well, we have room for one nurse, but we need room for two.
Oh, we'll just,
You can go in there.
okay, we'll just one here.
Two people come over from there,
Yeah, and I'll go in there and see.
Yeah, they probably just. Oh. School warriors.
Okay, I'm so late. Do you see the exhaustion?
Yeah.
Do you see the exhaustion?
So, okay, Yeah, so for celebrations, I wanted. Okay, for celebrations, Davis? Yes, I caught the nurses today and asked if they would be willing. I know they were on duty tonight at parent teacher conferences. I asked them if they would come in and so that as a board, as a district, we could publicly thank them and acknowledge all the work that they've been up to the past, well, couple months. Really, it's since the start of the school year. Well, because you were part of our Return to Learn in the summer and a lot of meetings with Johnson County Public Health, and then it rolled right into contact tracing. And you know, as our numbers the last 3 weeks have increased, it's increased in an inordinate amount of time, evenings, weekends, that they put in tracing, working with Johnson County Public Health, and just working with our administration. So, board, here's an opportunity to thank them and acknowledge the work that they're doing.
So, well, I know it's not happening. I can start as a parent. I mean, we've gotten a call, so you're working every single day. And I told my wife that too. I mean, I feel horrible. And it's like, how much more can we help or what can we do? And, you know, I see that you're making calls on Sundays and letting people know. And I mean, as a parent, I appreciate it 100%. I want you to know that I don't, you know, it's not likely that, you know, I hear about that, or I know how much it's just, you're calling everybody, you're doing things throughout the day. I can tell, and I feel bad, but really do appreciate all that you guys are doing. But, you know, whatever we can do to help or ideas, I mean, I'd be up for it. So
sure, we'd love for you to spread the word that we have been faced with something unprecedented, as we've said a lot this year. And we'd love our community to just be supportive in these protocols that we didn't come up with these protocols, but we sure have to enforce them for the safety of our school, our students, our community, and our staff. It's been super challenging, I'm not gonna lie. We've put in some exhausting hours. I feel privileged to work with our families that have been supportive for what we're doing. There have been families that haven't been, and that's really hard on our pride and our profession. It's exhausting. But a lot of times we are the messengers, and we are doing the best we can to keep everyone safe here in our community.
I know the board's more aware of it, but maybe not so much the community. If you want to kind of walk them through contact tracing, your relationship with Johnson County Public Health, or just kind of all your day. Like
sure.
That.
Want me to take that too? I talked enough today. I'm good. So we've been working with Johnson County since the summer, preparing for this and what it would look like coming back to school. Weekly phone calls with Johnson County, learning the protocol, learning all these numbers, the 10, the 14, the 2 days back contact tracing. We've been trained on all of that. We are continuing to meet with Johnson County every other week with all school districts in Johnson County. So we get to hear what other schools are doing, what mitigation strategies are working, how can we improve, how can we do things better at Solon. So that's one piece. Johnson County has been a great partnership. We are in contact with them either by email lately every day and or phone calls if we have a situation that we want to thoroughly understand what's the safest for our district. We'll contact the team. And unfortunately, they know us well by name, and we know all of them by name. It's been a great partnership. What it takes when we find out a case, we do investigate with that family, and we trace back 2 days from when the onset of symptoms have occurred. And that's, I think, hard for parents to understand. Well, why was this kid at school? Well, they were healthy then. And then 2 days later, they get sick. So then we do a lot of education. These phone calls don't take just 2 minutes. It's a lot of helping families understand what that means. And
then, like David said, we're contacting the families and helping them. Not only our families, our staff have lots of questions. So we're taking phone calls 4:30 in the morning, 7 at night, just to help our staff. And I don't say that needing gratitude. We do it because we care about our community and our staff. And they come to us because we're their healthcare professionals here at school. So I take quite pride in that, and I know Amy does too, that they trust us in our leadership with some of these tough questions. But it's definitely a process. It takes time to do all of this when we're working with Johnson County. And then we have to submit line lists of who they were in touch with, and so that they can follow up through that process. Did I miss anything? That was a real.
No, I think the thing I would add is that some families seem to get frustrated because we can't tell them all of the details of the contact, and we just can't. So sometimes I think we probably say more, even more than we should, because Johnson County will just call and say, you've been identified as a close contact, you need to quarantine. We try to put a little bit more perspective on it. Like, okay, in the classroom, everybody's got masks. So think about where you might not have masks on at school. I mean, we try to make them think, but we cannot tell them. So I just hope that they understand that I wish I didn't know all the information I did know, but I do. So it's not that we're trying to be, concealing things or not being completely, there's just certain things that we can't share.
Which is good to share with the community, because human nature wants you to share. And I'm not clear about that word I get. Right?
That's the first question everybody throws.
Well, and that's even with the dashboard where we felt we do have to uphold FERPA rights with the school district. And so we want to provide information to our community, but we have a lot of people that want to know specifics. We're too small of a community. And people already know. Some of these phone calls, they're like, oh, it's so-and-so. Well, I can't tell you that. Because we got to remember, these families are sick. We're forgetting some of that here, is that people are sick with COVID. And Amy and I talk a lot about this when we make these phone calls. The first thing I say is, how are you doing? Right. There's a lot of criticism to these families, and then that child is going through, when you just took out the sports team, what's important here, education or sports? We need to remember that we're all human, and some of these people are sick and they're scared, and they have loved ones who they're worried about. So I do say this, I just want us all to come together and remember we're here for each other, and I feel such a divide, and I don't like it. And that's not just here, it's everywhere. This is where our country is with the pandemic. But those are some phone calls we field out too with our families.
So just because I somewhat do this, okay, we still see patients.
Yeah.
Okay, we still have to go through this. We've changed our protocols daily. Providers have gotten it. I understand what you're going through. You're in COVID fatigue now, right? You're just tired, you're frustrated, things change all the time. You can never set your feet day to day. I understand, okay? What we need to do as a district is we need to set out, this is what the nurses are doing, right? Like this is their process. There's something called HIPAA, all right, that we cannot pass on information. The district could be sued for hundreds of thousands of dollars. This stuff makes me upset with our community, okay, because I know how hard you guys are working. I know, people are doing the best they can. This is unprecedented. We don't have a playbook. And so when we have people who are trying their best and I hear that people are mistreating them, that makes me upset, okay? And I would ask you to have them email me, and I would love to talk to them about your issues and that stuff, if that's how they feel comfortable, because you are part of why we do what we do. Okay, you're here to make our community healthy, and I know it's hard. And I know it's hard. Kids want to be here. We've heard that over and over tonight, and they want to have senior years. Okay, I get it. No senior year in our house last year, possible senior year this year. So I understand why they are the way they are. We all understand it, but I think it's important from the top down that we send a message, okay, that it's not okay to treat people in our district poorly. Our employees, that's not okay with me, okay? And I understand parents and emotions are high, and I understand that, I agree with you, okay? If there's a divide, and it's divided in a lot of ways, but I think I got into this for students, okay? And I hear students tonight, and I hear their need to be here. The only way they can be here safely is with you two doing your job. And the Department of Health down in Johnson County helping us, and our administrative staff supporting them. So what can we do as board members to help get this out so you know and the community knows we're 100% behind what you're doing? And I don't know what that answer is, Davis, but I think we're all, you shouldn't feel bad about trying hard to help people. You know what I mean? That's just not okay with me. You know, so I don't know what the answer is, but.
Well, this is a first step.
Right.
This is terrific.
Right?
Yeah. Yeah. Give us an opportunity to visit with you, to hear what's going on, let Doug record what's going on, and to be able to report that. And those are the steps that we have to take. But, and yeah, don't hesitate to give us some feedback.
Right.
Whether it's directing somebody off your plate onto ours, or more importantly, let us know if you see something that you think we need this, or we could use this. That's our goal.
Well, I will say, the principals have been super supportive in our goals. I can't say enough. Like Jessica's here, she's my principal for 2 of my buildings. Super supportive every step of the way. When there's a case, she's right there with me. Of course, Amy is. We joke today, we're lucky we like each other because we're spending hours and fun hours together. But the principal's support has been fantastic every step of the way.
How much time are you on the phone? Like, is that something to delegate duties to somebody else to kind of help with? You know, when you're having a contact trace and talk to all these people and all these things, it's got to take a lot of time.
We talked about that. So phone calls to parents can last anywhere from 10 minutes to, I was on the phone for over an hour one day. We talked about that in the respect that I think it would make more work for us to have other people do it when they're not trained. Because there would be, well, now you need to follow up with this parent because of, and that's what I want to put here. Like, that's part, I love that part. Like, I love helping educate. I love helping, you know, direct them where to go, those sorts of things.
So I just had to pick. If you made a video, okay, no, I mean, honestly, of the like basic, this is what we go through before we call you. You know what I mean? So, and then we'll just ask every parent to watch that before they call you, so you don't spend the same message, you know what I mean? Like, we have to go back 2 days because of this. We have to go, I mean, because that, you say the same message how many times? You know what I mean? If we can take that message and just be like, parents, if you could look at this one time before you call, then maybe we can just deal with the details more than you know, I give the arthritis speech about 1,000 times a day. You know what I mean? So I get, you know, if they could somehow, if we could have something that before we call them.
Kind of what happened before I got the phone call.
Right.
So that they understand the background.
Right.
It's not just allergies. That's what I want to lead with. It's not just allergies.
Oh, they just have cold symptoms. That's COVID.
Right. Well, until proven otherwise. Yep.
There's no right or wrong answer in it. We are here to serve our students and our staff. Our number one with healthcare is safety. That's what we say every day when we come into this building. How can we keep our kids safe?
Well, you should be beat up for that.
And that's what we'll continue to do.
Yeah, and Dan, you hit it on the button. I know when we had a student test and we lost a group of, just in one swoop, 21 students, it's like you bang your head on the table. It's like, no, I mean, can't we narrow this down to fewer? And then you step back and think about it. No, if we're going to keep kids here on site, online, that's just the way it's got to be.
Yep.
Yeah.
Well, I look at some of those, I look at that as learning opportunities.
Absolutely.
So what can we do better?
Right.
You know, I feel like we have really looked at our classrooms. What can we do in our classrooms? You know, our teachers are like asked to do 10-fold above this year. And we've got seating charts and we've got every aspect of their day. But each time we run a case, it's like, oh shoot, we could do this better.
Yep.
And I guess that's, I don't look at it as failure. I look at it as, okay, are we keeping kids safe again, or their loved ones?
And then what can we do better next time to make it run a little more efficiently and tweak our practice a little bit more for the better of our community and our school district.
So I just went through a football season. Right? And if those kids understand what it's going to take to play, you're going to get compliance.
Well, I will say I am concerned that our athletes are saying, don't tell anybody.
Right, I understand that too. But I mean,
And
if-
so,
if-
I mean, I
if
don't know
one
how
person in
successful
the
you can
wrestling-
say,
If
you
one
know.
person in the wrestling room gets it, and nobody has a mask on,
Right,
you know what I mean?
right,
They all know they're out, they'll wear masks.
right. Our basketball team needs to take the same consideration.
Right, for sure, absolutely. But if they know that, I think that if you can tell those young men and young ladies,
Yep.
I think they get to make those, like, all right, 15 of us are out, because we're gonna wear masks.
Right.
You know what I mean?
Right.
But if they
Right
wear
now, we
masks-
are very lucky that we have that option if we are mask to mask.
Right.
Lynn County is not following that. So
Right.
again, I just urge everyone to continue to do their part,
Yes.
keep their masks on.
Yes.
But everything changes, so this
Yeah.
is today. We'll see what tomorrow brings.
Well, that's what I was gonna say too, it's constantly changing.
It
We're
is.
frustrated too, right? The shields, the gators, like, even helping buy stuff for, and then we get flack from people in the community and,
Right.
why did you do this? And, it's a moving target, so we're all in it together and, it's one day at a time.
Absolutely.
It's the best decision you can today. And I think we appreciate, I saw you guys at the beginning of the school year, we were I stopped into the staff orientation and we were talking to hear how the year was going. And I was just impressed. You guys were on top of it back in the whole week. First day that staff are back and the meetings, you guys were already worried about first day of school. What happens when we get that first positive case? What are we going to do? And I know you guys were working through that with Josh and Justin on public health. I commend you for all the hard work. Every time I hear someone, it's like they are doing everything they can, and they're doing more than anyone could have expected them to do this year. So I think we just have to be appreciative of all the effort you're putting in. You guys are in that difficult spot where you probably care more than your body has the energy to do. And it's just hard. I think that probably goes across our entire staff. Our teachers are putting it in. But I think you guys are in the hardest part because you're dealing with those people where that first response is like, no, it's not really real, because obviously it couldn't be, because I don't want it to be. And so you've got that initial response, and you guys have to work through that. And so I commend you for all the effort, the long hours during the week, the long hours over the weekend, as you deal with these cases that come in. And as everyone said, we've been looking for opportunities to do it. I think Dave just said we're going to have some additional nursing support that's going to be in the building to help you out even more between now and
And that definitely has helped. Tim, sorry to cut you off there. That has been helpful because honestly, the minute we walk in the door, we're already calling families about either exposure or quarantine measures or giving them directions on how to get a test. We're on the phone all day. So it has helped. Hopefully we can continue to have a sub-nurse, because after the pandemic, there's still great opportunities for us to do other things and have a nurse available. So very grateful for a sub-nurse this year, because kids should come first, so we can't do both. It's hard to assess students because we still have injuries. Man, I'll take an injury right now over COVID. I'm like, I know what to do for that. But it's just not physically possible for us to do it all.
I wonder, we've got the one sub-nurse. I wonder, I'll throw these out. I know that there's a shortage of everything, but I wonder if, we have a seat, some of our students are going through the CNA program up at Kirkwood. Are there opportunities to maybe pull in students who are in college who might be home for a couple months at winter break, who are going through those medical programs? Are there options there where we could bring somebody in on an hourly basis to say, you're going to come in and your job is to hand out medicines during the day, so we can free up the nurses to do things that are bigger. So I know you guys have been trying to think about creative options, but as we've got those kids that might pop home for 2 months, maybe that's something we could look at as another option to free up some of your time. Because I know a lot of those little things, they just have to get done, but they take up time.
Right.
And unfortunately with the contact tracing, you have to train.
Right.
And you guys are our contact tracers, and
Right.
So.
Right. Looking forward, I would love to do, and again, shortages are everywhere for teachers, same for nurses, but I would love to get a pool of people who'd be interested in something, just like you have a teacher pool. And that way it's just not one person, it's like, okay, if that person's not available, and post it and see if there'd be some community members and do, you know, a process just like you would for some teachers. Here's our pool of available people that we could call. I'd love to build that program in the future.
And I think another thing to think about is even for beyond this year, you know, I feel like maybe even do an internship. You know, we've got a student who's going through Kirkwood or University of Iowa and a CNA and nursing company. Can they do an internship for a year where they got a couple days a week they come in and just relieve the burden? So I think there's options. And maybe this is the time to think creatively. It might not help us tomorrow, but it might help us, you know, when we get that bad flu season in 2 years and we've got 20% absenteeism at the middle school. So you know, I think so if there's ideas you have, I think we're receptive to it. If, you know, if you need us, if we think, okay, this would be a great idea, let's start planning now for how we move forward. So we've got options, you know, more options in the future. Because as you said, we're learning from this, and it's like, what can we do so we'd be in a better position if something else happens in the future? You know, this is a bad pandemic, but you know, they come every 10 or 15 years. You get a pandemic. This one's just more deadly and more infectious than the last one we had. And, you know, we'll get another one during your careers. It's not gonna. You know,
Let's hope not. This is enough.
Yeah, so, it's just a roll of the dice. You know, you hope it's not as bad. You know, it's a roll of the dice. You know.
Absolutely.
And this time we rolled snake eyes. So. Anything else you guys want to share with us? I know you guys had a long day and you probably want to go home and see families. And
this will be the earliest I've been home all week. Yep.
Okay.
We'll enjoy it.
Yeah. Absolutely. And again, if there's anything you guys need at all, you know, you reach out to the principals, to the superintendent, feel free to reach out to me. Well, if my email was working, I got here early to check my email, and Google is telling me my account is temporarily unavailable. I haven't seen the email since 10:15 this morning. So that could be a good thing or a bad thing. It's probably a bad thing because we'll find it later. Thank you, guys.
Thank you. Thank you.
Okay, next up is reading data. Yep, reading data.
So I was asked to comparison data. Data to show proficiency for percentage of students at each grade level, comparing before we left school in March to when we returned in August. We anticipated a drop when the kids returned because they had so many months outside of school, and that's what we saw when we got back and we benchmarked. So you see FAST data, which is the state testing that we do, required K3, which is why it says NA for 4th and 5th grade, because we do not do FAST at SIS. And then benchmarking is our reading record data, and we benchmark to see whether or not the students are proficient at grade level, so where they're expected to be at their grade level. So you can see that when we left in March, the green number is the number of students who scored proficient or above proficient, so we call that exceeding. And then the red number are the students who scored below proficiency, and that includes both just below proficiency and far below proficiency, so that's both of those. And then the September column is where they were at when we got back, and we benchmarked them upon our return. So you can see there's a significant decrease in the percentage of students who were proficient when they returned to school.
I want to try to understand the data. So if I look across current first graders, that would be, so the data in yellow for September 2020 is this year's first graders numbers when they got back. And it would have been the number for March would have been the data for that same group of kids when they were kindergarten. Okay. Sometimes we get data that goes diagonally, and I'm trying to make sure I'm following the data correctly.
I was asked to follow the students,
okay.
The students. So, yep, it says what the current grade they're in.
I just want to make sure I've messed this up in the past. So I just want to make sure I understand the data.
No, that's okay. We've been working really hard. I shouldn't even say we. The teachers have been working really hard and the interventionists and the coaches to provide intervention support for our lowest or our neediest students. And then looking at in the classroom interventions for those what we consider bubble kids. So they're at least level or two below, and those are usually quicker to catch up. We are starting to see, which I can't wait to be able to come back and show you what the winter data shows, because I think it'd be really interesting to show that our students are starting to bounce back, and we're starting to see growth in them, so which is encouraging.
And so we'll get data points on this kind of winter and then again in the spring.
Yeah, absolutely. So we benchmark again January, February, and then again in March.
So that's what we wanted you to see as far as when we paused in March and schools were closed.
Right.
From March until August 31st, this 22-week layoff for kids, 22 weeks. And so, you know, we were really accelerating them last year. Then we had the closure, 22 weeks of minimal to no education. We get them back. There is decline, but in the short amount of time that we've had them, you can see how we're starting to ramp up that trajectory. And I really, Jessica and I were talking, we really can't wait to see the January, February data.
Jessica, I'm going to ask a dangerous question I'm going to ask you. So I know one of the things we focused on last spring was, you know, there wasn't a lot we could do, but we asked families to focus on literacy at the K through 5 level. And so these are literacy numbers. And so even though that was our focus, we still saw some deficiency from last spring before what the effects they would have expected from them. Do we have any sense on some of the other subjects like math and other things where we kind of pushed them off to the side a little bit and said, you know, let's focus on not losing our reading, particularly that K through 3 level? Are some of the other subject areas, are they the same sort of decrements that we're seeing? Are they worse? You know, are they less? You know, what is your sense from that data?
So that's a trickier question to answer because we're not as solid, in my opinion, of how we screen, diagnose, or even intervene when it comes to a subject like math. So this year we implemented a math screener, which then gives us a good picture of where our kids are at. And then we've been trying to do a lot of learning on math progressions and kind of utilizing what we know in literacy to apply to our math instruction. So individualized learning, small group, co-group, formative assessments, identifying where kids are at and giving them that specific instruction. But with the current state of everything, it's been exhausting. So we're trying to be very careful with that. So hopefully next year we can have solid data to share. But we do know our kids are low in math as well. So it's what does that instruction look like and what kind of support can we get?
And that's based more on formative assessment that the teachers are just in their daily lessons and instruction.
We have a lot of teachers. So we've been working on focusing on the math standards and our priority standards that we identified last year. And then really breaking those down and identifying learning targets per grade level, and then using the screener to identify, okay, based on those learning targets, where our students' most needs are at, and then how do we instruct for that to fill the gap.
What screener are you using?
Boulder, well, it's not called Boulder Valley anymore. But when we started, it was called Boulder Valley, and I don't remember what it's called now, but.
Well, I mean, it even did something for me. I've got young kids, right? And, you know, even my wife having my kids read during the summer because she knew there'd be slippage. You know, it's kind of staggering for us too to see one of ours that kind of fell behind, right? They're reading, they're doing everything that we thought they were doing, but some of the comprehension stuff kind of took us a step back. We're like, well, yeah, I mean, you could say go read for 20 minutes and some of that, but that's stuff that you guys identify, and it showed up right away in September. And I know he's working on it, and you guys are doing a great job tackling it to, you know, figure that out, and us work with teachers to ask questions after reading a book, or, you know, but yeah, I fully expected it, but it is scary, and that's, you know, as parents, we want our best for our kids, and we don't want to see them fall behind, and I know it's a lot of work, so.
And the fortunate thing is it's Solon, and so in all the districts I've ever worked in, even starting, we had high percentages, so, and we see our kids bouncing back, and for most of them it is mainly focused on comprehension, because most of them were accurate and fluent readers. It's that comprehension piece, or even thinking beyond the text, or they struggle, which does impact their score overall when we benchmark them, because comprehension is a big piece of the benchmark. Especially when you think about our third graders, fourth and fifth graders, we try to shift from the fluency and accuracy of reading, but to more of the comprehension focus. Still understanding that the fluency and the accuracy is important. So.
That's a great point, Justin. And I don't want to downplay what we're looking at, but think if the March numbers were the yellow numbers. Some districts are dealing with that, so think of where those districts are. So that's a great point. What would, and I don't want to hold it anything to anybody, but what would a normal summer look like in terms of what's lost anyway? I mean, we're always going to have, there's always the argument for year-round school, right? Because you don't have that slippage. So, I mean, would normal slippage be a couple percent, 10? I mean, you know, is that?
Yeah, there's always a summer slide.
Yeah,
there's always a percentage of students. If I had to guess here in Solon, it's probably average 5-10% for a minimal year from what I've seen so far in my year and a half here. Typically, it's much wider in other places.
That's good. I just wondered.
This is definitely a significant decrease, I would imagine, that Solon has seen, but we also have never been in an epidemic. So.
Thank you so much for this PhD paper. Let's see in-person training versus virtual training. And see what these numbers are. It'll be interesting to find out.
Right.
You know, like, is it same? Is it different? Is it?
Yeah, it'd be fun to see all those numbers because they're all going to come out. Yeah. Oh, yeah. Good stuff. Yes, thanks.
Thank you very
much.
Thank you,
Davis.
Tim, I was going to, I have planned to give the board just a quick overview of some COVID things. To honor Amanda and
our troopers will come.
So we'll do them first.
We do them first.
Yes.
We'll let our troopers go. They have long days.
There you go. You go first because I can get long-winded.
Okay. All right, so we are here tonight to talk to you about 4333. I don't know how familiar you are with 4333 and your exposure of what you had, but that is what Haley and I are hoping to be able to enlighten you with kind of the journey and current reality of what's happening at Solon. So, as you know, you have the graduation requirements that we expect with the rigor and everything for our students at Solon High School. And when we talk about a 4333, it is going to be the requirements that every student would have 4 English classes, 3 science, 3 social studies, and 3 math classes. And so last year, through the different learning and things that were happening with the structure of our courses, we were able to offer a foundations class and a conceptual science class. And the rationale leads into this 4333 work from the standpoint of we want our students to still be required for those essential outcomes that we have set up for them in their learning. At the same time, we realize, and we know this through our work with ICAP and things that we have done, that there are different opportunities that all of our students will desire to go pursue when they leave Solon High School. And so those types of courses might be more relevant for the students that maybe aren't choosing the course for a 4-year college and beyond. And so Haley, with her special ed instruction, so the 4333 lends itself for that initial conversation when we think about our special education students. But as we present tonight, I want you to realize that this isn't strictly for special ed students, but it's definitely going to feel that lens tonight as we talk to you. So current work that is happening. So as you know, we continue to work on our standards work when time allows right now with everything going on. So we continue to do that with in our content areas. This past year, math and science and English were areas that we were really able to start thinking about how that could look different for some of our students and how those IEPs might look different for students and thinking about the 4-year plan for our students and the pathways that they are selecting. The special education department meeting with all of the general ed teachers within our departments were able to get together. Sue Vandergraaf, who was our Grant Wood special ed consultant, she retired last year. It was our hopes actually to be able to present this to you last spring with her. So I do want to honor that she was a big part of our learning with all of this as well. So right now, we currently are doing this with some individual students, and Haley will be the expert to kind of share some of that learning. And we were able to share some of this 4.3 initial learning with our staff. And then when I talk about math, the math, the science, and English department, they really have been those liaisons with the special ed team, and I've been able to do some of that work, and with Sue, to really think of how we can have these pathways set out for these students. So there's been a lot of that collaboration that has taken place.
Just in case for those who don't know me, I'm Haley Lansing. I'm one of the special education teachers at the high school, and I'm pretty much going to tell you what I do day to day. So the glue to the 4.3 is the collaboration piece. What I do is, and the special ed teachers, we collaborate with our general education teachers. They have the content knowledge, we have the strategy knowledge, and we just collaborate all the time, essentially. We take advantage of our CLTs in the Thursdays afternoon. Before pandemic happened, we actually had scheduled times to meet with the core classes of the 3.3 general education teachers. Another type of communications we do is through Google Docs, also informal and formal collaborations. It is nice to have a coffee pot in the special education room so we can, bring the gen ed teachers here and we can also collaborate. So what we talk about is sure you've seen this before, we talk about the standards. A lot of the students, all students work towards the priority standards. So for the 4.3, we just focus on those priority standards for what we feel is best for the individual and what matches their IEP. That being said, it's not necessarily if you're in special education, you have to go part of this plan, it's just whatever works for the individual student. So we really focus on the priority standards and what needs to be taught, and then that's when the collaboration begins. This is our kind of stuff that we have been working on. I know general education teachers are working really hard on wrapping the standards, but we can use this and benefit us for the special education world too. We provide SDIs, specially designed instruction. And that is instruction individualized for the student to help with their IEP goal. So knowing this knowledge, let's just say we have a child with a reading comprehension goal. Knowing the key vocabulary words that matches with the standards is very essential, and I could use that information or the big ideas, and I can use that in my SDI instruction. So that's kind of what we've been collaborating about. Here's some examples of what I've been using. Again, this is more for individual students. These may not work for all students. For math, what the biggest change what we did is called reverse teaching. I collaborate with the math teachers. They plan, they tell me what to teach, but since I'm a strategist, I go and teach that individual student. And then I give them the test, and then I have the math teachers grade it. So we call that reverse teaching. That's been very successful. Some strategies I use was like a whiteboard for test questions. A lot of that could be like anxiety ridden, just seeing that test, you're like, oh, I have the information, but now it's a less anxious environment. For science, you can tell the difference between the priority and the supporting standards. All students are using both standards. However, those who qualify focus only on the priority standards. So there's priority standards tests. So that means there are tests that the student doesn't have to take. However, that doesn't mean they're just hanging out in my classroom while everyone else is taking the supporting test. They're actually still working on the previous priority standards test because they need that extended time and need that additional learning time. And finally, for English examples, again, focusing on the comprehension standards, so we could create a rubric focusing on the questions based off the standards. And then the writing, for an example that we did the pros and cons. The standard was about pros and cons on the research project. Everyone had to write an essay about it. Instead of writing an essay about it, we just changed the product to what it looked like, and then we changed it. Instead of an essay, this individual did a picto chart.
So as Haley shared some examples of some things that have happened with collaboration with teachers for individual students, as you can see, social studies is part of that 433, and that is one area that we have not been able to have that focus. So that would be kind of a next step to be able to work through those priority standards so we have that kind of end product that we're hoping for a student, so they would be able to reach that capacity as well. The big thing that we know, we have these graduation standards for these courses set up currently, but so that's where in the past we've had special ed students that were just kind of grandfathered in to be able to get that diploma, and so this is going to be that ability for kind of this next round of students to gain that diploma or that certificate by receiving their 433. So that can be done through that standards-based IEP goals, and that is something our special ed team is doing an amazing job. They are willing to take on this task of really looking at every student's IEP and starting to make that shift so all of the students' IEPs are written to a standard-based goal, which is not an easy undertaking. But then that IEP team, when they meet, that will really allow us to sit and say, okay, these are the courses that would allow this particular student, as they're going through their coursework at Solon High School, to achieve that 433 to receive their diploma. And so I think just continue to work with the staff, with the collaboration that's going on, and getting you guys understanding what we're trying to do and that support, and other stakeholders understanding that this is an avenue for students to have success and achieve that diploma is what we're here to hope you're understanding.
I'll speak for family and young lady in my home life, and I've watched this process as we go through, and I'm thinking, how is this going to happen in the high school? And before we had the new science class, conceptual science and these sort of things, those things are super exciting to me, because those give opportunities for kids to be in science that maybe don't have to be, they're not a four-year school, that's not their goal, and they can follow that pathway and be very successful in a different way, where really I had concerns about that before those sort of things started happening. Just the more I hear about this, and the more I hear you doing, it's why I'm proud of this community and this, because all you hear about is how much you do for our kids. You know what I mean? You're working your tail off. Why? For the kids. You know what I mean? And thank you very much. Okay.
Questions for the rest of the board? I think it's kind of, I think I'll reiterate some against, having been through the process with our boys going through these schools. You're always trying, it seems like this is going to be more straightforward. And I don't know if it's going to be easier on your side, but from a parent standpoint, this seems like it makes more sense. Because I was always like, I don't get, he's got these graduation requirements, and how are we getting there? Because you're just not seeing it. It seemed like there were always, it's like, we'll make an exception for this, or we'll make an exception for that. And this seems like it's a more thoughtful, in advance process for this is what your path looks like. And you've got input in this, and the whole IEP team has input in this. It just seems like it's a more student focused. How do we make you successful? And what's the path for you to get a diploma and not feel like it was just handed to you because you spent 4 years in a building?
Absolutely.
That's great.
Yeah.
And I think we all appreciate the amount of work that goes into that. And like everything got thrown up in the spring. And I remember Davis talking to me about this, on the agenda sometime in the spring. And I'm glad you're reminding me of that, because I'm like, this sounds familiar when it first comes up. And I'm like, oh, this was supposed to be last spring. So,
and this is a presentation that you gave to Grantwood AEA.
Yeah, so we did this for some teachers last year at Grantwood AEA, and then we also met with some different districts throughout the state, I don't know if it was summertime or during quarantine, but kind of sharing our path as others are, trying to get their feet wet. And we're by no means experts, but it's exciting to know that we're.
How did you say Sue?
Sue Vandergroff, yeah.
Can we send her an email or something and just let her know? Yeah. Because sometimes those things pass by, we don't take time.
So I'll ask a follow-up question about the talked about earlier. You've got different kids that are on different tracks, and so some kids, maybe more hands-on. Are there opportunities when you look at, if there's some tech track classes at Kirkwood, is that an option as part of this as we look outside and say, in order to get this, you're interested in this area, we could make this, we could make, maybe somebody wants to do, I know your husband's in golf, maybe somebody wants to do turf management. And so maybe we could do that math. I know there's a turf management math class that deals with how do you decide how much chemicals go on.
If you guys give it the okay, that would count as a math or science course, then that's the support and the piece that needs to happen with this.
And I think we want you, you tell us.
Put it in front of us.
Well, because we have the graduation requirements, right now, but you had given that example about like the engineer program at Kirkwood. That was something that we were talking about. And that would be the perfect example of a student that's not going to go on to, a four-year college, but they want to be working at a body shop or doing something like that. So the course through, the Kirkwood Academy doing that could potentially fill their math or science coursework. So that's the next steps.
And I think as part of this, and I'm going to interrupt you just because, you're only the superintendent. Those are things that could easily come to us as part of, if we want to make an upfront exception to the requirements of the student, it could come in as part of the consent agenda. If it needs board approval, it doesn't need the student's name. It's just, student X, and this is the plan. And the board could say, yep, we're fine with substituting. So I think that's something we're going to do, because we've talked about this in the past. We want to do what's best for the students. And if you guys have ideas that meet the spirit of what we want to do, but for a particular student, we need to adjust it. It's just like kids that are, we get kids that are advanced and they want to take these classes at college because they, we've got kids who've taken classes over the summer on their own and are now have exceeded our coursework. And so we're looking for, how do you get your 4 English classes? Because, you took all the ones that we would require, but you didn't do it quite the right way. And now we're short on English classes or math classes. So we're here, and I think we're flexible and responsive to what the needs of the students are. We don't want to let our structure impede doing what's in the best interest of the education of our students.
Well, it's just that, I look at it like this, because we had this a while back. It's a triangle, right? And the 4-3-3's in the middle. And that's kind of where this is. And then down here's this, however you want to set the triangle sideways. So special ed's over here, and that's where these accommodations come from. And then up here, those kids you're talking about, those accommodations come from. That's the same thing. If the kid's taken 4 math classes, but he took one of them in 8th grade, you know what I mean? Put that in front of us. You know what I mean? Because to me,
see, because correct me, what we run into right now is we have 433 requirements here in state requirements,
right.
But then Solon actually tells you what 3 math courses are required. So if we had some flexibility with, what, instead of taking Algebra 2, we would accept this math course if it meant that's your path and track. That's what we're talking about right there.
You're the experts. Bring it, let us hear it. We're all for it.
So that's probably to a topic when the high school brings their course of study for approval. Then they might also bring, okay, listen, when we're talking about, because we did this 4 or 5 years ago, it used to be the state's always been 4-3-3-3. Solon was 4-4-3-3, required 4 years of social studies. This board said, listen, let's go back to the state requirement of 3 years, and instead require kids to take, instead of that 4th year of social studies, require them to take personal finance. So this board has the ability to make those adjustments.
We should.
Yes.
Absolutely. Yes. So yes, be creative, and if you think that if there's something we're doing that's standing in the way of what's the best interest of the student, please let us know, and we'll do what we can to make things work. So thank you very much.
Thank you.
Thank you.
Thanks for sticking around. I know it was a long time.
Yeah.
So fun. So fun.
Yeah.
Welcome to stay.
There's not the lead.
There's a meeting for Jess needs to stay. Correct?
No.
Jess, you can go. You've had a long day. You got kids. Slip out of here.
Okay.
Absolutely.
You're welcome to say if you want.
Thank you.
Thank you very much.
Don't look back down the stairs because I might be right behind you.
In an hour.
Come on, Patriot. Come on, Patriot.
Yeah, that's going on.
We're going
What's the
back.
number? What's the number? I'll give you the number.
We're going back to admin report.
All right, and what I want to do is just give a very brief overview. Versus did a good job of giving you just a little piece. Just know that our data dashboard has district data, and I know there's been a push as far as we want more data, we want it broken down by buildings. Well, Johnson County Public Health, Iowa Department of Public Health do not recommend that. They say don't. It needs to be district-wide.
So put this in the paper. We're listening to our experts.
So
guiding us.
That's why the dashboard is as it is right now. Know that the dashboard has the data that it does. Right. We, as a district, we look at that. Right. We look at that absenteeism, which includes all illnesses. Right. We have kids home because they tested positive, they go in absenteeism. We have students home because of sinus, strep, flu, all those other reasons. Yep. They go into that absences. We also, we've got quarantine listed on there. That's not an absent, that's a separate quarantine. We're telling that child you're staying home. Right. We look at staff availability, and we look at, and we also have been most recently the last few weeks compiling those numbers and looking at overall percentages of students not in attendance. Okay, so, and then staff feedback has been very important. We don't use any one. So we don't put a marker on, hey, as soon as we get 10 positive tests in the building, we're shutting down. We use a combination of positive, absenteeism, staff availability. I mean,
we shut down one class?
We could.
Okay.
We could quarantine a class, shut it down. We could quarantine a grade level. Okay. We were close. At SIS, we lost 4 out of the 5 teachers. They had to quarantine. Right. They were exposed. They had to quarantine. We were able to cover those 4 teachers. It was difficult. Now, if we had to go another week, we probably wouldn't have been able to cover, but we got through that.
Yeah. And one more thing, Davis, so I understand. If a parent sees these numbers, they're uncomfortable.
Yes.
When they started, they were online or they were in. Those are the 2 decisions. But even now, right, they could, in the middle of this, just be like, hey, like Tina Hoffman said. Yes. If I want to pull Brayden, she can just pull him, right?
Yes, early November, when we start just kind of seeing an uptick, not only in our building, but across Iowa, in our region, we sent communication out to parents saying it is increasing. And at the bottom of both those communications, listen, if you're uncomfortable at this point, go visit with your principal. Okay. We will make accommodations. And, we've got those online platforms and we'll do all we can. Our teachers are doing a great job with videos and posting videos on those platforms and having them available and having the lessons available. It's not the same because there's not direct instruction, but it's still.
Before you look at what you just, I want to make sure that I close the loop on something there. The numbers that are on our dashboard are the numbers that the nurses are putting in every day. So they're going through this. And so our nursing staff, amongst all the other things that they're doing, contact tracing,
yes,
are the ones who have to go and deal with making sure they get the numbers in. So this is just another thing on their plate because they're the ones who possess the data for those things.
The secretaries are helping with a portion of like the absenteeism.
Yeah.
But the nurses are responsible for the rest of that data, and they're the ones doing the great job of putting that data on the dashboard. Yes.
I just wanted to be clear on that because I've had some questions. It's like, how do we know that Davis is putting the data in for? I'm like, Davis is not putting the data in. This data is coming from the buildings. And
my technology skills. Yeah, there's a spreadsheet that they're using. That
we've seen them.
Yeah, you can. Here's.
I didn't ask you to use my email.
Yeah. Like to see this?
Yeah.
Not good.
And so
I typically just tell Davis to hand it back over to me.
That's what I like.
Good
Josh. Where'd that come from? I thought you got off.
Oh, I'm here.
Josh can fix my email.
So there's, what we, speaking of Josh, he used the word, we use those data points as kind of screeners. So one of those data points can wave the flag.
Right.
And when we see that, it's like, okay, let's really dive into all those data points in a combination of, I'm going to skip ahead on my notes here. For an example, as I look at data, and I'll come back to this, we've got 20% right now as of today, 20% of our high school students not in attendance. Quarantine, absenteeism, just a variety of reasons. Okay, that's a big red flag.
Right.
So we're looking at that data. Zach has a rock solid leadership team, teacher leadership team that he meets with regularly. They met this morning. They went through the data as a team. They problem solved some other areas of mitigation. And then they had a frank conversation as far as, okay, what do we do from here? Or do we keep going, or do we look at maybe an alternative plan right now? Do we, which could mean, do we close the high school for a short period? Not the district, just the high school. That came out of the meeting, those teachers were overwhelmingly united in, no, we keep going. Based on the current data now, based upon staff availability, based upon how we're feeling right now, the best thing for kids is to keep them going, and we're capable right now. We're not there yet.
But these are daily visitations, obviously, if numbers change, right?
Oh, we review it daily. So I said, based on that team made that decision as a team in that high school based on the data that they were looking at today. So now with that said, I mean, we've got, a high number, 20%. In the next 3 days, Friday, Monday, Tuesday, we're going to see probably 40 students back.
Right.
Coming back from quarantine.
Right.
Now, I'm going to say 35 to 40 because in the last few days of their quarantine, they might develop symptoms.
Right.
So I'm going to say 35 to 40 return. Right. But now keep in mind, it's a fluctuating number. We quarantined, I believe, 7 to 10 more today.
Right.
So as we get a wave back, we're going to have now, hopefully we get big chunks back. Right. We have another 35 expected to come back on Monday the 30th.
Right.
So that's another big chunk.
Right.
So we just continue, it's a daily number that we look at.
And then you look at like the nurses were saying, right? So let's say this event happens and we have to quarantine 8 people.
Yes.
Then we reevaluate that. All right, we can do different mitigations situation here where we can.
After every incident, we do an AAR, an after action review.
Okay.
And we, circle the wagons like, okay, what caused this?
Right.
And what can we in our control do different, do better? Okay. Absolutely. Just know too, we've really, this pandemic has really brought the district staff together. It's created a lot more opportunity for us to work together, to do things together, to have conversations. A lot of inputs coming from building leadership teams that principals are working with. We've had conversations, very productive and beneficial conversations with SEA, the association, teacher association leadership. Very productive, very positive conversations. We started the year with that shirt, back and better together. Truly, we're together. And what's been neat too is I think you've received some emails from parents that hashtag that or put that on there. So it's really almost galvanized us as far as coming around, putting the safety, putting the learning, putting kids first. It's really galvanized us on that topic.
So Davis, what do we do as a board? Everybody's going above and beyond right now.
Well, so based on the feedback that we've been receiving, we've already implemented what we call strategies in a COVID year. We may not, ever implement these strategies again, but in a COVID year, we're just going to do things different.
Okay.
One, we've already contacted our list of subs. Now, they're very few. We have 7 that have been very consistent with us this year. We went ahead and Natalie and the secretaries principals. We identified these 7 subs. We've contacted every one of them and said, we want to schedule you from now until December 22nd, every day, regardless of openings. Come in, you're scheduled. Listen, if we have 7 vacancies, we've got them right there, we'll plug them in. That prevents, because one thing that's worn teachers out is the covering for each other.
Right.
We've got a vacancy, now they have to cover for each other.
Yeah.
So we want to eliminate that. So now we hope to have a pool of subs ready to go every morning that we've already scheduled. If we're like at SIS today, we had no vacancies. Every teacher was there today. And so, listen, if we've got extra subs, go to SIS, rotate through classrooms and give those teachers additional breaks. That's the plan. Now, we also did that with sub-associates are hard to come by.
Right.
So we reached out the same way, and we put an email out to our staff. Many of you have AJ coming home?
Yeah.
Many of you have, she would have got the email, many of you have kids that are off at college, that a lot of colleges at Thanksgiving are breaking until January 25th.
Right.
That's a long span. If your child is coming back from college, and if your child would like a part-time job, we'll schedule them every single day through December 22nd. They can be a sub-associate. They can help at recesses, at lunchrooms. They can go in and give teachers breaks.
Right?
Yeah. Well, so we're working to fill the sub-associates too. These ideas are generated through conversations. We added the sub-nurse. We locked her in, come every single day through December 22nd. Amy and Chris will direct where they need you. Just report to Lakeview every day. If they need you elsewhere, they'll tell you. So we've got a sub-nurse coming every single day. We have, we suspended our school improvement. So, we're always growing professionally. We're always providing. We told teachers, let's just focus on what we know now and keeping kids safe. Well, we're going to suspend that for a while. And along with our TLS system, which is 5 coaches, Amanda included, we're going to suspend your positions from now until December 22nd, and you are going to help with vacancies. Amanda has spent the whole week teaching 3rd grade. So, again, we're doing our best. We don't want teachers to have to cover for other teachers. We want to be able to make sure that the time that they have in the day, they can keep that time to catch their breath.
So what can we do? I mean, people are working their tails off. What can we?
We suspended Thursday afternoons.
For them.
For them.
Like, can we? I mean, here's the thing. We can't gather them together. Can we? You know what I mean? Even if it's just morning, something. You know what I mean?
I think it's a good question. I think the question is how do we best make them feel appreciated? I think we all appreciate them.
Right.
The challenge is what do you do? But we say thank you to them when we see them, but the question is how do we make them all know? I guess it's a good question because it's some of the things you normally do is like having we had Rick and Jim go grill out burgers at the in-service thing. Those are things we can't do right now. But
just know that every employee, not just teachers but staff, receive one of those big, thick, prepackaged monster cookies from what kitchen?
Sugar Bottom Kitchen. Sugar Bottom Bakery.
Yeah,
that's one.
Yes.
Yeah.
Yes. And that was just a big thank you on a Friday morning when we had those sitting in the lounge for everybody.
There's a community group that's providing every employee a meal on Tuesday. They're Venmoing this person and they're gonna bring in a meal for them.
That's perfect.
And this is that group that just so appreciate our kids being in school, knowing that it is hard work to keep this, but again, it was a great testament to the high school staff and what they're doing. And again, they're looking at the data and right now, based upon the data, they're saying, no, we better to keep going right now. So just know that these ideas were generated, maybe some at the admin table, some were generated through conversations, one-on-one with teachers or from building leadership teams. I was talking with one teacher and she said, right now, as our numbers have increased for quarantine students, that's additional work. If we're gonna really give students that are quarantined the best we can in a quality while they're home, we're gonna need time to create those videos, to put those up onto the online platform. So the teacher suggested, if we had a little time on Thursday afternoons to do that. And so we just went ahead and suspended Thursday afternoon work. That's completely devoted to how teachers want to use it. They can get with their team to create some stuff or plan, or if they need to do some things individually, or I know some teachers are going to use it in the afternoons while they're on contractual time to reach out virtually, Zoom with some of their quarantine students. Instead, what we're hearing is a few teachers have done that from 4 to 6. So just know that we're having lots of conversations. We're taking all the feedback we can, and we're implementing and doing all we can within our means and resources for these teachers. So I want to just go ahead.
If you want to talk a little bit, I know one of the challenges has been as staff is one having to quarantine and other issues. I think we've got to get creative about helping those teachers out in terms of getting the appropriate classification for their leave and making sure that we're supporting them by being able to keep them on payroll and supported by the district, even if they, as they go past some of those things that were required to do by law. So I don't know if you want to speak to that a little bit or not.
Well, so Natalie and I spent a lot of time with callers and understanding the CARES Act and leave and all that stuff. And so, at the beginning of the year, we talked with a lot of teachers. Now, when it's been really good, the teachers a lot of times are like they said, they'll go to the nurse, and the nurses know, hey, I'm going to direct you as far as leave and Natalie. She's our contact person. And, if Natalie has questions, we work on it together, but we are guiding teachers in that and helping them utilize the CARES Act. So those teachers that have had to be quarantined or those teachers that have tested positive because of the CARES Act, we've helped navigate to where they don't use any of their own personal sick bank leave. And or we've had a couple teachers who live outside our school system and they have children going to a different district which closed. And so helping those teachers navigate, okay, under the CARES Act, since your child's attending a school district that actually closed, here are some things that we can do that won't necessarily impact you financially or dip into leaves that the master contract doesn't have or whatever. So yeah, we are continuing to have those conversations too. The data, if you want just, yes, again, nurses said, we are in constant contact with Johnson County Public Health. They just sent us new guidelines that they would like to see implemented for winter sports activities. Casey has those in hand. He's already met with coaches a couple weeks ago before winter sports started, laid out. It almost aligns. There's a few things we need to add to our plan, but we'll align to Johnson County Public Health so that we can keep these kids on site the best we can. We've had from 11/5, November 5th, to today, Thursday the 8th, Wednesday the 18th. I did not put today's data on there. So in that 2-week span, we have had 40 positive cases with our 1,500 students, about 2%. 2%. 23 of those 40 have been in the high school. Now, beginning 11/5, the percent of our students that have been quarantined district-wide, 4%, 5%, 5%, 6%, 7%, 9%, 12%, 11%. So that's kind of the range that we've had district-wide in the last 2 weeks. We've been as low as 4, as high as 12. Total percent of students not attending our school due to absenteeism, quarantine, all purposes. They're just not there. The district combined, our low has been 6% on November 5th. Our high has been 15% on November 18th. If we just look at the high school, like I said earlier, 20%. And that's part of the figures that the high school staff looked at this morning. Like I said, in the next 3 days, we should see 35 to 40 kids return to the high school. We are going to have today or tomorrow combinations 7 to 10 more leave. So
with the high school, are we finding out that it's more in school when you look at contact tracing, or is it outside
yeah,
of school? Or
let's
is
see.
it a...
Josh worked on data the last couple of days. He broke that down. Zach has broken that down also. We have had, I would say at least 75% have been outside, but we have most recently, we've had some cases from the musical, so some activities that are less controlled in a classroom. Yeah.
2 nights ago was the last that I don't know if you can hear me, the last that I had really dove into that specifically. And it was 35 students were quarantined based on a contact with somebody from school in a school setting. A big chunk of that 35 was from the musical with 1 positive student. So there was 14 that had to quarantine. It was either 13 or 14 that had to quarantine based on that. And then the other 30 plus was from an outside positive exposure, whether it was a parent or another friend from outside the district or other relatives. So
for the entire year from August, I'm going to go back now, from August 31st to now, we've had to quarantine 25 staff members. 18 of those quarantines were the result of outside the school system due to family or such. 6 of those quarantines were close colleagues eating lunch too close together. That's one of those after-action reviews. Right. And then we did have a colleague that was exposed, had to quarantine because of a student exposure. So that's 25 total out of 225 staff. And I say 225 staff, give or take a couple due to resignations or recent hires. So just right around the 225 mark. We've had 25 staff who needed quarantine. We've had 13 staff total test positive, which would be 0.5% of our employees. Yeah, go ahead.
Just are we seeing repeat quarantines? I know, like, for students and for stuff. I know, like, my niece, she's one of my nieces has been out twice in quarantine. Just we call it bad luck. She's not both times she's been fine, but she just happens to be in the wrong place at the wrong time, and so her sisters have never been out, but she's been on quarantine twice. I just wasn't sure if we're seeing that.
We've had a few, and I could probably, I bet I could count them on a hand, maybe 2, but we've had a few. And I believe the board received an email from a student that said, "I'm quarantined twice and I hate it." Yeah, yeah.
I think on the quarantine side, I think it's an important thing for us all to remember. When we started this process in the summer, the whole issue was quarantine is meant to try and prevent additional spread. And so as we go through it, we're going to Johnson Public Health, and we're erring on the side of caution. We'd rather quarantine you and have you home than risk you spreading it in the building. So yeah, I think that's the important thing to remember is that we obviously want as many kids in the building as possible. We also want to continue our quarantine efforts. We don't want to undermine those.
Yeah.
Yeah. So to that point too, Tim, I think understanding over the last couple of days, almost all of our positive cases have been students that were already quarantined. So they weren't here. They've been quarantined because of a positive exposure at some point over the last 5 days, whether it was over the weekend or Monday, through today. Well, then we still have to contact trace because, and I missed when the nurses were in there, they might have already explained this, but if their symptoms started 4 days ago, we have to contact trace 48 hours prior. So even though they haven't been at school for 4 days, we still have to go back to last Thursday and Friday and contact trace. And there might be other kids then that we identify that need to quarantine who have been here since that exposure to that individual who, since being quarantined, had been tested positive, if that makes sense.
Yep, it does.
So just know, I wanted to give you the last 2 weeks data. I mean, yeah, it is increasing, and it really has increased at the high school. As we stated earlier, we started the year prepared for on-site and for virtual. And we really stressed with our teachers that in our preparation is be prepared and ready to transition fluidly back and forth if necessary. Have no idea what the year is going to bring. We're fortunate. I think we can all take a deep breath. Geez, we're about to Thanksgiving, and we probably thought we wouldn't have made it this far. We'll continue to look at the data. We'll continue to use those data points and our teachers as staff, part of that feedback.
Well, and then from an expectation standpoint, one of the things I can do on data is, I stopped in at the first day of the school year thing. I listened to the presentation, kind of hung out in the back, waiting for everybody before everyone broke up. And, I thought you were fairly blunt. You told the staff on that first day, it's not if, but when. And, we've gone into this with the idea that we're prepared, that we were gonna see a positive case. We were gonna see kids quarantined. We're likely going to have to go to online sometime this school year. And, I thought you were fairly blunt that first day. And I think it helps set the mindset, which is, our goal is to keep kids as safe as we can, keep them in the building. But we realize that these things are not unexpected, which is why we've been planning for them.
Yeah. And again, I think one of the parents brought it up. We do understand the anxiety that comes with the pandemic. And as these numbers have increased, some you heard are very uncomfortable, yet the numbers haven't reached a level where they're uncomfortable. Other parents have reached that level. So again, we communicate to the parents the option that if they want to take a 2-week break, a 1-week break, a 3-week break, go visit with your principal, and we'll accommodate you, get you set up. To this point, we've had district-wide 7 at the high school, 12 at the middle school, 11 at SIS, and 7 at Lakeview that a parent has visited with a principal and said, hey, listen, I'm going to take a little break for a while and just see where these numbers go.
Well, I'm grateful they have that choice.
Yeah.
Yeah, and we'll continue. Now, and Sean's doing a great job with, and our principals with computers if students need them.
Did we get the last batch of computers we were waiting on?
Yes, yes. We have 40, on Edmonton or Apex to start the year. 41 of those students have a district computer. 46 of our kids that have been quarantined grabbed a computer on their way out the door. And so, right now we've got 87 computers out. We prepped and planned for quite a bit more if we need to disperse more. So, we still have computers if we need to, and that was part of our return to learn. We shifted some money over and ordered a lot more technology.
Because I know we talked, Mrs. Chapman was here earlier.
Yes.
We talked about the fact in the spring, they had a need and we couldn't fully meet it because we were in that odd spot where we just didn't have, we weren't set up to provide that many computers out there. I know we did a lot of staff time over the summer and into the early fall, and so I'm glad to know that we have options that if we have to go, we can accommodate those.
Any questions on where we're at or what we're doing?
So thank you.
Are we thinking about one of the things, I don't know if somebody here mentioned it was in one of the emails or something. We know at Thanksgiving, people are gonna get together. So are we thinking about what we're so from Thanksgiving Day, that next 2 weeks is gonna be really.
It will be.
Touch and go, and so is there anything extra we're doing, or are we everybody kind of mentally prepared that we might have a spike in the next 2 weeks after Thanksgiving?
I think that's probably part of the reason why the high school maybe part of the rationale as far as, hey, we know it's there, but right now staff availability is still good. We're still managing. You know, the numbers are here. We hate to break now. And then, like you said, come back from Thanksgiving and 7, 8, 10 days after Thanksgiving, all of a sudden we start to see it hit. And then, so if we need, I think they wanted to wait and see and better prepare for, that might be the time where we really need to. Yeah. And you know, Zach has already started talking about, and part of their meeting this morning was, as a staff, okay, let's just start playing out the scenario. All kids are home for a short time. What does that mean for staff? So staff come in, what does that mean for IEP students? What is it? So they're just going back through the plan, just like the nurses said. We knew we'd have a case. Back in August, we knew it was just a matter of time. Not if, but when. And so we had our letters already typed up, all ready to go, so that our first case, we weren't scrambling and trying to craft a letter. They were ready just instantly, give me the name and address, and we'll send them out.
Davis, going to that point, I think John's kind of public health has some postery things. I don't know if we can work with them to customize one, which is just a reminder. As you think about the holidays, these are, you know, our goal is to stay in person. And please remember, wear your mask if you're outside, if you're with people outside your immediate family. You know, wash your hands, maintain social distancing. I don't know if we can just get a communication out that reminds people that for us to stay in person, we need you to think about this over the next time, and you know. And those typically come from principals, and I know Zach. I don't know if we've got something, John's technical help that we could borrow. Yeah. I think they got some. I think I saw some graphics that someone had shared. It might be easy to work with them and customize something. Sure. Just remember these things as you're heading to. I think we've all got to do our. I think we've all got to do our part. You know.
I mean, it's a great point, and that's, and we have had a lot of discussion about Thanksgiving, and then what's that window coming back? Where does that put us in December? And are we prepared to stop, go virtual up to Christmas, and then come back?
And then if we, I mean, I'm thinking if we see a big spike after Thanksgiving, then do we think about Christmas as well? Like the next 2 weeks after Christmas is over, maybe we're virtual for those 2 weeks, and like everybody has to stay home to get through that, so they're not all coming together. I don't know.
Yeah, and you know, it's
the hard part is leave them home.
Yeah, they're all
keep going another 2 weeks.
And this is, and we
so
talk,
where does it ever end?
So I think one of the challenges, and this is where I put that.
it's like calling a snow day.
Right.
Do we call it they're calling for a snowstorm on next Friday. Do we just cancel school now? Do we do a quote? I mean, it's
well, I'm
hard.
not saying we should necessarily do it, but are we like extra mentally prepared for the teachers and the staff, extra mentally prepared?
And that's
this is
that's
more
a great,
likely of a possibility.
that's a great point. I mean, and that's good communication to throw out a few scenarios for staff to be prepared for. Yes, prepare for this scenario, prepare for this scenario. That's a good idea.
I think you've got to do it in a way that doesn't stress your staff out, because you've got too many things out there. I've talked to some teachers in other districts where they're in a constant state where they don't know, are we closing? You know, I've got 3 lesson plans I've got to do because I don't know, are we going hybrid? You know, are we going online? You know, what are we doing? So,
yeah, you have to be careful because you don't want people starting to read too much into that.
Absolutely.
They're getting ready, they're going to do it.
Right.
Yeah.
Right.
And Davis, I shared a copy of this. This is, for those of you who don't know, I like to read stuff, and so I downloaded the World Health Organization's what do we know about COVID-19 transmission in school? Because I don't have enough other things to read. This is their October update, and there's a nice little thing there with 9 things that are reminders of things to do to help keep schools open. If these are the 9 things you should focus on. So we may be able to share something like that out, or something that Johnson County Health has, which is just those reminders of things, we're encouraging our kids, if you're not feeling well, stay home from school. Right? Don't interact, wear a mask, maintain distance, all those fun things. So, Davis, this is where the board hates me, and I'm going to ask a couple questions that they're probably redundant with some of the things we had. I think you've touched on them, but at a high level, talk about how our teachers are doing. I know you've had conversations with the union, you had conversations with leadership with your advisory team, you had conversations with the principals and their advisory team, just at a high level, where are we at? Because from a mental health standpoint, that's one of the things we worry about is we want to make sure our staff are not, we don't push them past the tipping point. And so, what is your sense of where we're at and kind of what are you doing to get that? So,
well, and again, it's a data point. So, I mean, I haven't talked with all 112 teachers. I've talked to many of them, so it's hard for me to, to be fair, to generalize based upon feedback from principals who are more in contact, based upon the conversations I have had with individual teachers. They're, of course, tired. They're exhausted, and they'll say, I'm tired, exhausted, but gosh, every one of them has come back and said, but I know this is where kids need to be, and things are going well, and things like that. So, again, we're really relying on those conversations between teachers and principals, and then those conversations that the teachers are willing to have with me as far as getting a good gauge. Now, the Solon Education Association put together a survey. I spoke with leadership, and they talked to me about the survey. I think they're very good questions that they're asking their staff. They're going to collect that data. I think they're asking all teachers to complete that survey by, I believe, noon on Sunday. And then leadership's going to kind of go through it, collect some themes, and then they're going to meet with Josh and I as far as walking us through. So that'll be good feedback too.
I think, the more information we get about how they're doing and how we can support them, just like with the nurses, I think we want to do what we can to support our staff. And I'm going to do something I shouldn't do. I'm going to do it anyway. We had we looked at the election. I told you
that should have been at the beginning.
So one of the things we talked about is just as we head into the holidays, I think we mentioned this a little bit with when we pull all this up. If we sense that if things are stressful at that point in time, then we try to extend that break out a little bit and add a couple days at the beginning, and we don't go back that Monday, Tuesday before we start winter break, and give just a couple more days on there. Does that it gives the teachers a little bit more time to recover? Obviously, the board, just so everyone that's online and watching this later, the board has delegated a great deal of authority to you to pull the plug on those things if you think it's the best bet. If you don't have to come to us with those things, but I think my sense is, we want to do what we need to support the board. I think or the staff. I think if we think that that's the best bet, we just need to do it early enough that families can plan.
Oh yeah, yeah.
So I think,
go ahead.
Stay attuned. I think we're encouraging you to stay attuned to the staff, and if we think that if being able to just disconnect is getting rid of those 2 days is actually 4 days because you don't have to plan for those 2 days. It does add them to the end of the school year. That's the bad thing, but.
Maybe not.
Well, it depends on the hours,
Right.
And depends how our snow days go.
And it's and you know what? I know we're committed to 180 days, and but when DeRachel hit, we delayed school 5 days. What we did was we added 2 student days back and devoted the other 3 days to teacher prep. And so, are we going to have 180 days this year? No, but it's a COVID year. Right. So now that took us down to 1089 hours. So the minimum we have to meet 1080. We have talked about that, Tim, in discussions at the admin table. Where are we at? We kind of put it into terms of basketball. You get a 30-second timeout and you get a 60-second timeout. Now, where are our staff? Where's our staff at right now as far as that tipping? It's like, I've just kind of reached it. I need a timeout. So do you need a 30 or a 60? And so these are conversations that we've had with some teachers as far as where are you at? Where do you perceive your colleagues to be at as far as, and this was early this week, late last week, when we started having these conversations thinking, maybe, we've got tomorrow Friday, and then we come back on Monday, Tuesday, and then break for Thanksgiving. Do we need to drop Monday, Tuesday? Do we need to take that whole break? Do we need a 60-second full timeout, or can we get by with the 30-second timeout of just the 5 already scheduled days? Where are you at, teachers? I had 2 of them tell me, listen, Davis, if you would have asked me this last week, I would have told you we're there. We need this full 60-second timeout. But things kind of turned a little bit, and some things fell into place. And you know what? I think the 5 days, scheduled days of Thanksgiving will be nice. I think we'll be okay. Okay, that's great. But you know, now we can look at December. We come back on Monday the 30th, and we go 3 full weeks plus on Monday, Tuesday. Well, who knows what Thanksgiving will bring.
Right.
And so come December 7th, 8th, 9th, 10th, how's that gonna look? And so it's like, maybe that's the time if we want to look at a longer break for teachers, staff, and such. We could look at the Monday, Tuesday, drop it. If we did that, that would provide 16 full days of, over that winter break. And when I was talking to teachers about those options, they really like the idea, that possibility of getting, if we can get to that point, if data allows us to get to that point of taking that time to take a long extended break before coming back. So if we can get to that time, I think we're looking at that very hard, very intensely.
And that's just what I want to bring up. You know,
Yeah.
you and I have had some conversations. I just want to bring it up publicly so that the entire board.
Yeah, I don't think that's a bad idea.
No. Okay, any additional questions for Davis?
Great stuff, great information.
Okay, next up is the consent agenda. So we're moving now.
Anything on there you need to talk about there?
So I've got good news and bad news for you. The board committees are set. And I had already sent those to Chris, so that'll be your surprise for later. Chris and I discussed them. I tried to take it.
I will see that Dan will be pleased.
Oh,
I'm not on the policy
thanks a lot.
committee.
Rick will be less than pleased.
I'll make a motion for this consent. At this point, I don't care. What is my journal got?
I just said, don't put it back on.
Motion to approve the consent agenda by Jedlicka, second by Haluska. All those in favor signify by saying aye. Aye. Opposed? Abstained? So 401. 401. Okay.
Pat sent you a sheet earlier, for the sake of time, kind of explaining these to you.
So, yeah, so just real quick, modified allowable growth. This isn't new money. It's spending authority to go with the fact that we have an increase in students that the state didn't give us money to pay for because we'll get the money next year for them. So I need a motion to approve the modified allowable growth.
Right there.
Motion by Coons, second by Wolf.
I need you to say the dollar amount.
Oh, in the.
Oh, yeah. It's on the agenda.
Right up there, buddy.
$128,273.60.
Motion by Coons, second by Wolf to approve the modified allowable growth for 128,273.60. Any discussion? No. All those in favor signify by saying aye. Aye. Opposed? Abstained? Motion carries unanimously. Second reading of board policy 108, discrimination and harassment based on sex prohibited. This is the new update that we talked about last month. It came from the state.
And we did add Zach as the primary, Jess as the secondary, and both names are on there, so they have a choice to go to who they want.
Yeah, you can see them right here.
Make a motion to approve the second reading.
Motion by Jessica to approve the second reading, second by Alaska. Does this also, just want to clarify, this puts Davidson as the appeal?
Yes.
Okay. So, I think that was the other thing we talked about last time is.
I don't know if I put it in there. I don't know if it's in there, but that's why we made sure he wasn't it,
Yeah.
right?
Yeah.
I don't think it's, you have. to
Because
put
the
it-
appeal goes to the next level up in
So it's automatic.
it's automatic, so
Okay, yeah.
when he was the primary, there was only one, the only thing you could do is come to the board, so we just wanted to clarify that. We had a motion and a second, all those in favor signify by saying aye. Aye. Opposed? Motion carries unanimously. Okay, next up is the annual settlement of accounts. This is the thing we are legally required to do every year when we reorganize. She has provided this table that is what we're required to send to the state. We have to approve it so she can send it to the state. It basically shows how we've done. I can't read that, it's too far away. But it basically shows where each of our accounts stands. That's a legally required document as part of our reorganization. It's not that much different than the stuff we get every month. It's just a matter that it's a summary of where we finished the year at. So I'll entertain a motion.
A motion to approve.
Motion by Wolf to approve, second by Alaska. Any discussion? I think we did as well as we could in the COVID year, and so our counselor and decent shape. I thank the admin team and Pat and everybody for doing what they could to keep us where we are. All those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carries unanimously. Okay, next up is the lease agreement with the city. As we're aware, the lease was scheduled through the end of December. The city's, as we're all aware, the city's trying to figure out how to make this community center work in the midst of a pandemic and longer term considerations. I had some conversations with, I think you've had some conversations as well. I think the general consensus is to kick the can down the road a little bit longer, and so we do a 3-month extension, following basically the same agreement we had in the past, which will get us to the end of March, and that gives us some time to, as we talk about later, we're planning on a joint meeting with the city that'll allow us to have that and have some discussions in that regard. So I would assume Rick as part of the.
Yep, I'll make a motion to approve the lease agreement based on the extension.
Motion by Jellicoe, second by Coons. Any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion carried unanimously. Okay, Van and Lyft purchased the nutrition department for $39,162 from West Branch Ford. This is, Davis, correct me if I'm wrong, I think we probably saw some stuff. This was purchased through the state program, which means it's not bid out the same way we could do otherwise. And so I think we've got the option of running it through the state program, in which case you just choose, or you do an independent bid and you hope for the best. I think Davis, I don't know if you want to say why we chose this route.
Yeah, we had 2 places that actually had a 2020. I believe Junkie Ford in Des Moines. There was a place in Des Moines and then the West Branch Ford. And West Branch Ford was actually just a hair cheaper, plus they're in our backyard. So we won't, and West Branch Ford, and they're also going to make sure to put the lift on it for us. So this van will be devoted for the nutrition department, and this van will transport meals from building to building. So before, we used a custodian to do that, and they used a district vehicle, and it was, 2.5 hours of the custodian, 2 hours of the custodian's day, which is cleaning time we need. So Becky's just doing it within her department, and she's got the funding in her department to purchase this van, so it'll be the nutrition van, and in their program now, we freed up a custodian.
Yeah, I thought it was good that Becky did that too with their staffing and divided up that responsibility and like manager. She's awesome.
Yeah.
Well,
and they love it.
And the other thing is the lift is going to be great for them. You know, because
And Davis, correct me if
I'm sure that's not like.
And correct me, Davis, if I'm wrong. I think we've got some flexibility to do this year because some of the flexibility the state gave us. This might not have been permitted in normal years.
This came out of the nutrition budget.
It's coming out of the nutrition.
Which is healthy anyway.
Which is healthy. But there's some flexibility this year because
Especially,
if I remember correctly, this is one of the things that we could do this year. But if you don't do it this year, there's no guarantee you could do it in future years. So
I make a motion to approve the van and lift purchase for the nutrition department for $39,162.
Motion by Alaska, second by Coons. Any other discussion? All those in favor signify by saying aye. Aye. Opposed? Motion carries unanimously. Okay. I'm not going to sign this, so we got to drag this meeting out longer. Informational items. Joint learning date for admin board. I think Chris has pinged you for this. She's going to remind you that she really needs to know some dates in early January to do this. Ideally, last time we did it in the morning, but because all the ISD things are going to be virtual, we originally thought we could do the same thing when we do this in the morning after they came here, but they're doing all those virtually. So our general thought is it's probably just as good to do it in the evening if that works for people. So let Chris know dates and times, and we're looking for kind of a 3.5 hour block where we can get together. It may be virtual, it may be in person, but the goal is to kind of build on that learning.
Instead of us, would it be better if you just put a couple of dates out there?
Yeah.
I do that. That would be easier. I mean, I've got nothing planned, so.
Yeah, if we all think of that.
You prefer an evening,
I mean.
like Monday, Tuesday?
We'll work on it, Chris.
Yeah. How long are we talking? 3 hours?
3.5 hours.
Yeah. I don't know what the total.
Church is not a Wednesday for you.
I don't know if anybody really doing church anymore. I'm saying no one's doing in-person stuff, so.
We try, as a board, we try to avoid scheduling things on Wednesday night. Schedule playoffs just to not set a precedent, because we don't want coaches going, well, the school board can schedule stuff. Why can't we?
I'd say Monday or Tuesday if you did like, is 3:30 work for people to get out for 4? Then it's not such a late night.
Yeah.
for staff.
Especially for them.
Yes, that's what I'm thinking of.
Late afternoon would be good.
Yeah.
I don't know what the total number is, but obviously that's much more beneficial face to face than it would be virtually, so.
Yeah.
If we need to wait because of some state requirement on the number. Think about
Well,
that.
I guess what I meant by virtual is that Terry might join us rather than in person. So the facilitator might not be here in person rather than us being
And
virtual.
will we have a topic? What is the plan?
Yes.
Yeah. And so.
Now, but that hasn't been solidified.
No.
So
Yeah,
there's,
Davis has got a
Perry may have suggestions, or we may say, hey, this is where we kind of like to target the conversation, or this is kind of what an outcome of the meeting we'd like to.
So I think the way I left it with Davis is he's gonna call Harry and get Harry's ideas and then ping us with some ideas on what he thinks. Building on what we did last year, how do we continue to learn together as a board and administrative team to move us forward?
So if you've got something that you want to throw around or want to play with, maybe email me or call me or stop by.
Yeah.
Join me in a board and city.
So again, we're looking at having that kind of in the first part of next year as well. I talked to.
What nights are they? Monday?
They're Wednesday. nights,
Wednesday,
5:30.
they went full virtual.
That's what I thought.
And so
Not that that's bad, but.
And so what we talked about with them was, what historically we've done when we met later in the evening. Did we lose your battery, Dave?
Yeah. It's time to be done. That's
And